Good morning and namaskar. I welcome all the esteemed dignitaries on behalf of Venu Institute of Integrative Medicine and Research to the symposium titled Integrative Medicine, the Next Frontier in Patient-Centered Care. We will begin our proceedings with a time-honored tradition of lamp lighting that symbolizes enlightenment, knowledge, and wisdom. The lighting of the lamp represents the dispelling of darkness and the triumph of knowledge, which is a fitting way to begin the symposium dedicated to learning and innovation. It is a great honor to invite our distinguished members of the board to the stage to perform this auspicious ceremony. Please join me in welcoming the board members, Ms. Sujaya Krishnan ma'am, Ms. Tanuja Joshi ma'am, Ekamada Yadav sir, Ms. Sumedha Sen ma'am, Dr. Rajan Yadyav sir, Dr. Professor Ashwini Seth sir, Mr. Tarun Basu sir, and Dr. Abhishek Dagar sir on the dais.
Guest of honor, Ms. Dr. Rajesh Mehta, distinguished speakers, honored guests, colleagues and friends. It's my privilege and great joy to welcome you all this morning. This year's symposium marks a very special milestone as we launch the Venu Institute of Integrative Medicine, an endeavor that carries forward our legacy of more than 40 years of selfless service under the Venu Charitable Society. The theme we gather around today, Integrative Medicine, the Next Frontier in Patient-Centered Care, truly reflects our vision for the future of healthcare, one that is holistic, preventive, compassionate, and inclusive. We believe that healing must go beyond treating disease to nurturing the mind, body, and spirit, and the best of modern medicine can be harmoniously combined with evidence-based complementary therapies such as naturopathy, yoga, nutrition, Ayurveda, homeopathy, and mindfulness. This aligns with India's plan of one nation, one health system to be implemented by 2030, aiming to integrate traditional and modern medical systems into a holistic patient-centric approach by unifying different medical systems in medical practice, education, and research. This policy seeks to provide uniform healthcare access and affordability for all citizens by allowing patients to receive treatment from any medical system based on the condition, their specific needs, and the available evidence, while also promoting a broader understanding of human, animal, and environmental health through the One Health approach. This symposium is not only a scientific exchange, but a curtain raiser to our mission and vision, a model of care that unites knowledge, empowers patients, and enhances health outcomes for all. On behalf of the Venu Charitable Society, I extend my heartfelt gratitude to all our distinguished speakers and panelists who will be sharing their expertise, and to each one of you for joining us in this significant journey. Let us together take forward the spirit of collaboration, innovation, and compassion as we work to build a healthier, more humane, and more integrative model of care for our people. Thank you and welcome once again.
much, ma'am, for reflecting our vision. We are now honored to call upon the dais Dr. Ashok Sharma and Dr. V.K. Batra, chairperson of the symposium, to come and chair the session. Dr. Sharma is a senior consultant at Fortis Escorts Heart Institute with over 4 decades of experience in clinical medicine with special interest in diabetes and endocrinology. It is my proud privilege to call upon Dr. V.K. Batra, the chairperson for today's symposium on the dais. Dr. V.K. Batra is a highly respected consultant physician and diabetologist with a career spanning over 4 decades. Dr. Batra served a tenure as the Deputy Director of Medical Services for Air India and as a consultant at St. Stephen's Hospital. Sir, I would request you both to please join us on the dais.
Thank you very much.
Thank you, sir. In the interest of time, we will take the question and answer session at the end of the first session. To begin with, our first speaker for the symposium is the advisor at Venu Institute of Integrative Medicine and Research, Dr. Professor Ashwini Kumar Seth. Dr. Ashwini Seth is a distinguished gastroenterologist with extensive experience, currently serving as the senior consultant at the Medanta Institute of Digestive and Hepatobiliary Sciences, Gurgaon, and Holy Family Hospital, New Delhi. Sir, I'd request you to please join us.
Do you have your permission to start? Thank you very much. I am indeed grateful, indeed indebted to the chairpersons and all of you to have come this morning in large numbers, really heartwarming numbers, having graced this occasion and graced this symposium. My job today is that of stagehand to unveil the concept of integrative medicine. Where did the idea germinate from? No system of medicine is flawless or complete in itself. All of you would understand that. Every system has its strengths and limitations. Just because modern medicine has been patronized, other systems cannot be dismissed as unscientific. Basic principles of the disease management of each is different from others. Therefore, the yardsticks of research they differ, and we must understand that. We cannot use the same benchmark of research applicable to all the systems of medicine. Current conventional treatments may not address all aspects of the patient's well-being. Therefore, there exists an opportunity for complementary treatments to offer comprehensive care, synergizing the strengths wherever needed. You would all understand and you will all appreciate that we are yet to come across a medicine which is without its side effects, and that includes vitamins also. And sometimes these side effects are serious adverse effects. Cancer, in several cases, the treatment becomes more torturous than the disease itself. And because of indiscriminate use of antibiotics, India has become a hotbed of superbugs not amenable to treatment. Further, super specialization has led to watertight compartmentalization of organ systems with no connect with each other. Unfortunately, today, patient is being seen as images and lab numbers and not a patient as a whole. There has been a quest by the human to actually compete with nature. And whenever we played with nature, we fell flat on our faces. We started altering the human physiological processes artificially. To just give you an example, the changes in menopause, the hormonal changes in menopause led to hormone replacement therapy, but the side effects were humongous and it was withdrawn. For example, breast cancer, the clotting in the vessels, stroke, and heart disease. There was a medication, a chemical actually, called as diethylstilbestrol, which was used to prevent miscarriages. Not only it did not prevent miscarriages, but caused transgenerational effects in the next generation. It came up as cervical cancer, other reproductive tract abnormalities, etc. in the daughters, and in the sons it presented as increased risk of genital abnormalities. Lately, just day before yesterday, I think, Ozempic has been given a go-ahead by the Indian government as a obesity countering medication. Good old days, we used fenfluramine and phentermine, which was given for weight loss, and it came up with heart valve disease, primary pulmonary hypertension, etc. You would have heard about the anabolic steroids, the drugs used by the athletes for performance enhancements, but it comes with a baggage of hypertension, testicular atrophy, infertility, etc., and mood swings. Human growth hormone for increasing the height and used anti-aging enhancement causes diabetes mellitus and cancer. You would just recall using the anti-aging medication, an actress probably just died just about a month ago. So there's a very loud and clear message. Stop playing God. Don't compete with nature. Let nature maintain the physiological balance and help it do that. So what is the aim of this institute? It is to give the best possible care to the suffering patient population, synergizing the strengths of various systems of medicine in a legally sound manner based on hard evidence. Integrative medicine in this country is the future, as many of you would know. One health system plan has to be met with by 2030. It has been launched by the government to merge allopathy, homeopathy, and Ayurveda. The synergy of modern medicine and ancient wisdom offers great hope for individuals confronting chronic diseases, including those dealing with the complex aftermath of viral illnesses, as we have seen in the case of COVID. A truly holistic path to restored health and well-being is by bringing together healing traditions, both modern and ancient. There is actually an increasing desire for holistic healing now, and there has been a growing trend and a very, very favorable opinion towards integrative approach to healthcare, which combines modern allopathy with traditional systems like Ayurveda and homeopathy. A study found that vast majority, more than 80% of participants were in favor of integrating homeopathy services into secondary healthcare settings. Many people use these traditional treatments alongside conventional allopathic medicine, especially for chronic conditions. The evolving trends are that there is almost everybody in the country today is aware of Ayush system of medicines. There is almost half of the people have utilized Ayush system in the previous 1 year. The predominant use has been for prevention of these systems, and primary reason for this, as I mentioned, has been rejuvenation and preventive purpose, rather than acute curative treatment. The dynamic is still working out, as the definition suggests, it's a dynamic. Allopathy remains a very strong preference. More than 70%, almost 3/4 of the normal population is dependent or prefers on allopathic treatment for acute sicknesses and the first thing to go to. Ayurveda has emerged as top alternative, and almost 1/4 of the public expressed their preference for Ayurvedic medicines, making it the most preferred traditional system. What are the drivers of choice? Drivers of choice for allopathy is convenience, easy availability and accessibility, and perceived efficacy for a very hectic lifestyle which most of us are living today. Ayurveda is chosen for its perceived low cost, lack of side effects, and use of natural ingredients. Integrative medicine the edifice of integrative medicine rests on its 5 strong pillars of allopathy, homeopathy, Ayurveda, naturopathy, and lifestyle medicine. I have given it another color, lifestyle medicine, because this is the most important and probably the strongest pillar, because all other system of medicine will draw from here. This includes nutrition, exercise and yoga, sleep, stress management, and spirituality, and de-addiction. There is some confusion regarding integrative medicine versus integrated medicine. Integrative medicine is a healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle. Integrative medicine places the patient at the center of care, emphasizing personalized treatment plans and patient empowerment. These two systems are complementary and not opposing. But remember that we are not talking of khichdi or mixopathy. Integrative medicine, on the other hand, focuses on the coordination and comprehensive care provided by a team of healthcare professionals. You would know that many hospitals have departments of Ayush along with modern medicine, but they still are not providing integrated medicine. The patient walks in there, chooses on his own without being guided or evaluated first. So our areas of activity would be clinical medicine and research. And initial areas of focus would be lifestyle diseases, that is non-communicable diseases, which is obesity, related disorders, diabetes, hypertension, anxiety, neurosis, depression, chronic GI disorders, functional GI disorders like irritable bowel syndrome, most of you would be familiar with that term, and inflammatory bowel disease like ulcerative colitis, which was alien to this country about 3 decades ago. But with the advent of the Western lifestyle, especially the fast foods and replete with emulsifiers, the incidence has increased. Rheumatic diseases and disorders of mobility, skin diseases, and gynecology. Why is this focus? Because current conventional treatments may not address all the aspects of patients' well-being. And therefore, as I mentioned earlier in the talk, opportunity for complementary treatment to offer comprehensive care. But remember, with integrative medicine, at least in this institution, we do not plan to have any major surgeries or intensive care or obstetrics, because there the other system of medicine not only suffices but is the most important system to follow. What is the approach? What is going to be the approach to the patient? Educating the patient regarding positives, limitations, and adverse effects of each system, and encouraging him to take informed decision in consultation with the experts. We would ensure sensitive and receptive healthcare professionals and support staff, and ensure a pleasant healing environment. You would have had the feel of that the moment you entered Venu Eye Institute today. How is the approach different? Because the focus here is behind the obvious. It explores contributing factors, it expands treatment options, and there is preventive health. The accent is on self. It promotes self-regulation, sense of self-efficacy, self-control and resilience, and confidence in self and healthcare provider. But there are some challenges, as is there with anything and everything we bring in. Conformity to various laws, not only various laws, but varying laws. National Medical Council versus Central Council of Indigenous Medicine versus Central Council for Homeopathy. And extremely important in today's day and age is social media influence. We have narratives built around one particular aspect, as you must all feel. There are prejudices which are very difficult to counter. But our thrust and our most important part we are looking into is safety first. Therapy that does not meet the safety or efficacy guidelines will not be included. When there is clear benefit of conventional therapy, we will straight away tell the patient that that is the best suited system for you. For example, in appendicitis, in sepsis, organ failures and severe disease, definitely the modern medicine would take an upper hand. The patient flow is going to be, we'll take the history and physical examination first, make a differential diagnosis and various etiologies to be considered, identify the tests that might be needed, and develop top priorities for an integrative approach, which means we will get what the patient and family is comfortable with. We will provide evidence of every treatment, set expectations, and then outline a flow-up plan. And therefore, the patient makes an educated and informed choice. The first contact of the patient will be with a counselor who is a medically qualified person. And many of patients who are very, very anxious or stressed would be evaluated, and actually most of the patients will be evaluated by a board and then guide the patient to make that informed choice. Clinical research forms an integral part of it, which will be the first one, and basic academic research would be taken up as a second step. Key stakeholders of Venu Institute of Integrative Medicine and Research have steadfast faith in the philosophy of integrative medicine. Our vision is to restore patients' physical and mental well-being by providing true holistic healing with empathy and not merely managing the disease. Thank you for your attention.
Thank you, sir, for the insightful address and educating us that no medicine comes without a side effect, and hence complementing the modern medicine with natural sciences for holistic healing is probably the need of the hour. The next speaker, Dr. Rajesh Mehta, is currently an adjunct professor at the Public Health Foundation of India and a consultant for the World Health Organization, lending his expertise to policy development and strategy development for newborn, child and adolescent health. He is the former regional advisor for Southeast Asia region at the World Health Organization. Dr. Mehta is the current chair of the International Pediatric Association's Working Group for Quality Improvement and Patient Safety. Please join me in giving a warm welcome to Dr. Mehta to deliver the keynote address.
Thank you. Good morning. Good morning, chairs, with your permission. This has been labeled as keynote address, but the agreement with Ashwini has been that it is more of a setting the stage session, because the experts will come later. So I thought we will use this opportunity to define some of the basics about the concepts, and then the experts can bring in the examples of how to do it. But before I begin, I have a couple of disclaimers. I do not claim any expertise in the matter. I have not acquired expertise in integrative medicine or alternate systems. It's a matter of chance that when I was in WHO India office, for 3 or 4 years, I assisted the government of India. At that time, it was Ayush department, not a full-fledged ministry. And from WHO side, I was assisting them in standardization and the councils which Ashwini mentioned were going to begin during that phase in 2006-07. That the councils for Ayurveda, for Unani, for Siddha, and then codification of all the knowledge which started. And through 2014, actually, the Ayush department of Ministry of Health was converted into a full-blown ministry. 2014, so it's about 10 years before. So I have used some WHO documents, some Government of India documents, and also used ChatGPT to bring down the concepts to be able to present to you. So it is well known by now to all of you that India is going through this epidemiological transition. We used to have a lot of deaths because of infections earlier, because of maternal and newborn conditions, which still happen. But maternal mortality has gone down about 60% from 1990. Child mortality has gone down by again 63-65% in India from 1990 levels. Infections have been overcome. A lot of child mortality used to happen. Now vaccines prevent that. A lot of public health measures like good water, good care for prevention has led to decrease in infectious diseases. So presently, large majority of deaths actually happen because of non-communicable diseases. In India, it's about 68% based on the global study of burden of disease. So the communicable diseases have gone down, NCDs have come up. And NCDs, as we heard Ashwini explaining to us, there are common risk factors which are related to lifestyles. So while we may claim modernization as our way of living, but at the same time it is counterproductive to health because we don't practice the health behaviors. So air pollution, consider that air pollution because chronic lung disease is also a non-communicable disease. In addition to cancer, diabetes, stroke, heart disease, the chronic lung disease is also considered NCD. So there is high socio-economic cost. So UN General Assembly presently in New York last week actually took up this resolution on non-communicable diseases, where heads of the governments have committed that much of prevention, promotion and treatment resources would have to be met for NCDs. So it's a global issue, and people have been labeling India as the capital of diabetes because there is a lot of burden in our society. So it's a major imperative of global development as well as in country that the Prime Minister and the current government has mentioned and committed that we will try to bring all types of health care systems for the betterment of Indian population. So we need actually for these lifestyle diseases related epidemic new thinking, which Ashwini already started enumerating, that it is much more prevention, promotion, not just treatment. Therefore, how do you tackle the risk factors? And when we say risk factors, one of the missing link there is the importance of stress. The stress which is underlying, several conditions of human morbidity and mortality, and it doesn't come out as a biomedical risk factor in our list. But stress is an underlying, malady which probably is contributing to much of long-term illness and exacerbation of underlying disease. So we must look out for alternate mechanisms in addition to the conventional healthcare system, which many countries have followed and labeled it as modern healthcare system. And it happens. It's a political. Health is a political subject. When royal patronage was there to Ayurveda, there was a Rajvad in all the, when we were ruled by rulers. So royal patronage led to acceptance in public. When the royal patronage shifted to, in colonial times, to modern medicine, so-called modern medicine, so public also got convinced and they followed at the cost of leaving some traditional wisdom. At mass scale you shift to modern medicine or allopathy as they call it. So it is important that the current government is trying to bring all the components together, because each one would have some relative advantage in some areas where there is a comparative strength. So therefore this concept actually has to be looked at, evolved and promoted. So WHO describes traditional medicine as an ancient system. Of course it is, and it is distinct from modern system and actually much before the modern system, and includes nature-based remedies, practices, skills and knowledge. Traditional wisdom was that it was person-centric, holistic approach for health and well-being. So absence of disease is not health as per definition. It is the well-being in all the areas or domains of our life. So it's social well-being, it's mental well-being, it's spiritual well-being, not just absence of disease. So therefore traditional wisdom actually included all of that. We believe that traditional medicine has to evolve further because the parameters of science have changed. So therefore, Ashwini did mention, I will reinforce that point, that it is evolving. Traditional medicine has to evolve in the scientific understanding. And I believe that the big data analytic systems which is available now, machine learning and artificial intelligence, should be able to accelerate our understanding and use of traditional medicine, adopting modern benchmarks of research. So when we did a study, when WHO did a study a few years back, 170 countries reported use of traditional medicine. 170 out of 197. WHO has 197 member states, and 170 reported traditional medicine is still being used. And many developed countries actually have now begun recognizing and integrating traditional medicine with the conventional healthcare systems. So industrialized economies, but in addition, the other countries like Chile, 71%, Colombia, 40%, African countries up to 80%, they use traditional medicine. And Ashwini actually just now mentioned that Indian data also suggests a lot of households do practice a little bit of traditional medicine, even if those are home remedies. So on the other side, complementary medicine is described by WHO as an additional health care practice that are usually not part of the country's mainstream health system. So for India, for example, if allopathy is the mainstream, the Ayush looks like a complementary system. But very soon, as the government is emphasizing, they could all be equal and come together as an option for people to take benefit of. So secondly, we are actually trying to use the potential of support the mainstream medicine can get from complementary systems. So WHO has a very clear position on using traditional medicine. WHO says that they recognize the diversity of traditional and complementary and integrative medicine. And appropriate integration of traditional and complementary medicine can improve health outcomes by increasing the availability of services, especially at the primary healthcare level. And as we understand more, probably we can be sure of using for benefit the alternate systems for even level 2 care or secondary level care as well. But WHO emphasizes, as Ashwini was mentioning, that evidence-based approach is crucial. Even if traditional medicines can claim that it is all natural and a long-term, long-used ancient practice, but efficacy and safety must be proven. So that's the challenge we all have to take forward. But the idea that whether the randomized controlled trials, which are the hallmark of the current pharmaceutical medical system, whether those apply equally to traditional medicine, they cannot, because the principles are different. So together we have to evolve some mechanisms which can actually satisfy the science-based inquiry on all traditional medicines step by step. Modern medicine had withstood because scientific rigor was built in, and over the last few decades we have seen that graded evidence-based medicine is the common practice now. In each clinic we practice evidence-based medicine. Same has to apply to the other systems of medicine. So already Ashwini has mentioned that integrative medicine is an interdisciplinary evidence-based approach for health and well-being. So it's not absence of disease but health and well-being, and combines modern biomedical system. Our allopathy is more biomedical. Therefore, our graduates which are coming out do not even think of the psychosocial overlay because the attention has been drawn to investigations, laboratory. So therefore, Ashwini's observation that this is a film number or a lab number which people are treating the reports rather than the patient. But Sujaya, we remember when we were taught in MBBS, in Hutchison-Hunter there was a clear description that there is a young man with impending marriage who has a dyspepsia. So the diagnosis should be written as a young person impending marriage with dyspepsia, not just dyspepsia. Okay? So it's not just Spantosate or any other PPI, but a lot of anxiety resolution has to happen. Right? So in current medical education system, these are being separated. So there is a lot of a strong case to bring back the basics and use the alternate systems where much more emphasis still probably exists for the well-being part of the equation. So focuses on the whole person, emphasizes health, healing and wellness. This cannot be overemphasized, and but it has to be evidence informed for safety and effectiveness at least. So that means the therapies from modern medicine and also from the alternate systems from both would have to be evidence-based. So there should be some evidence about effectiveness and safety of the therapies from modern medicine and from traditional medicine. But more importantly, that therapeutic relationship between the healer and the patient, that has to be re-established, and probably the strength of traditional medicine can bring that back to us better. There are, of course, benefits which are described here. Access to wider range of treatments and palliative care would be possible. So when we establish this institute here, people will have an option to choose between different ways to get healing. And managing side effects of conventional treatment, sometimes we can use integrative medicine for that. Mental and emotional well-being, keeping the stress down. Stress is an adrenaline. Cortisol is a very dangerous hormone for many health conditions, and for increased patient satisfaction. Of course, integrative medicine or the traditional medicine use will not replace and should not delay seeking modern healthcare. So therefore, one has to be careful and transparent with the patients and evidence-based that we do not delay the specific treatments but add on for benefit. So I will summarize the ethical consideration. There are well-known 4 pillars of ethical practice. So this must apply to integrative medicine. Autonomy of patient is supreme. Best interest of patient counts, and do no harm. So that has to be ensured. And of course, the fairness, the access, the justice, the equity part of providing treatment. So all these 4 parameters apply equally to modern medicine, same to traditional medicine and same to integrative medicine. So this ethical burden must be carried by each practitioner. So when you do this here, all these considerations will have to be considered in front. Indian legal system is quite complex. We still don't have clarity sometimes. Ashwini is more trained in legal area, so maybe we should march forward within the legal framework which India provides. We have regulation, clear regulation system is there. So each of our professions, from Ayurveda, from Unani, from homeopathy and modern medicine, we are regulated by our own councils and commissions. So that has to be taken care of. Many Indian courts have actually provided guidance on saying that don't mix pathies. So whether it is khichdi or parallel or integrated, if you are registered with modern allopathy medical council, the court does not allow you to practice or prescribe Ayurvedic medicines. Okay, so that clarity is there, but some governments have actually tried to change that by bringing in local policies. For example, Maharashtra state recently, a couple of years back, allowed Ayush practitioners, Ayush is our traditional medicine, to be able to provide essential allopathic medicine after some training. So they can prescribe paracetamol, they can prescribe some other primary over-the-counter and some primary care medicines, even if they are not registered for allopathy. Okay, so there are some opportunities and entry points available. But please remember, the liability and malpractice applies equally to the alternate system of medicines. So Ayurveda Charai is also bound by this concept of law of torts and negligence and consumer protection. And indemnity, professional indemnity insurance actually excludes non-standard and unapproved therapies. So your indemnity insurance will also not stand in to protect you if there is a liability. But there are hospital examples which will provide a firmament on how to practice integrative medicine. Many hospitals in India have Ayush departments. All India Institute has one. There are other government setups where, and government is promoting that the co-location of traditional medicine and allopathy should be achieved in hospitals. And there are departments of integrative medicine already, and the Venu is joining today. But outside these contexts of hospitals and departments of integrative medicine, the individual practice of alternate medicine by a person registered with another council is full of legal problems. Okay? And insurance companies are increasingly covering Ayush as per OPD guidelines, but only when provided by recognized and registered practitioners. So this is the list of common areas where integrative medicine has proven some benefits. Okay, you can see oncology, chronic pain management, mental health, diabetes, lifestyle, cardiovascular health, palliative and end-life care. But I was surprised ChatGPT did not bring in gastroenterology, my friend's department. Because we remember in GBP hospital when we were graduating from Maulana Medical College, Ashwini is my batchmate, there were studies going on yoga and meditation for GI conditions where psychosocial overlay was considered an important component. So IBS 1331, dyspepsia was another one. And Dr. Chutani, Dr. Mehta, you would remember, he's also my senior from the same alma mater, was using yoga abhyas with the patient. The Venu Eye Institute has a full-fledged research on gastroenterology and yoga and meditation going on. But ChatGPT has limitations, as you know. So finally, where is the government policy on this? Policy is very supportive. And going forward 2030, we look forward to some better, codified coming together of various systems of medicine. So National Ayush Mission alongside the National Health Mission from the Ministry of Health and Family Welfare. These are big investments. National Health Mission actually looks after maternal child health, big program, national program, and National Ayush Mission then brings in forces, and two of them together, the government is designing that both of the missions should work together. So that would provide multiple choices to patients. So integration into mainstream health infrastructure, the Ayush infrastructure, merging with the allopathic or the Ministry of Health infrastructure. Co-location of Ayush facilities has been happening at primary health center level, at community health center level, which is sub-district, and district hospital, and many teaching hospitals. Okay, so Ayush facility and modern medicine facility together, and then patients come and have a choice. At the sub-center and primary health center level, government is investing on Arogya Mandir, Ayushman Arogya Mandirs or AAM, and government of Delhi has recently announced that all the Mohalla clinics will now evolve into Arogya Mandirs. Ayush has similar scheme. So together, Government of India presently is bringing 150,000 Arogya Mandirs in the rural hinterlands of the country. So that means either the Ayush facility will take charge or the primary health center of Ministry of Health will take charge, and they will have staff from both Ayush department and Ministry of Health working together. Okay? And there is a Ayush vertical presently in the Directorate General of Health Services in Nirman Bhavan, Ministry of Health. There are integrated Ayush departments within medical colleges, largely Government of India medical colleges, which is Suffolk Hospital and Lady Harding. And this latest PIB press release, February 2025, gives a lot of information. So there is a lot of policy support available. You will see the list of initiatives by Ayush and Ministry of Health coming together. And these are the national programs where Ayush is already integrated. Okay? For non-communicable diseases, clearly, there is a merger happening there. For nutrition mission, for maternal newborn, for geriatric care. More and more geriatric care would be required in India because population is aging. We have young population, but more and more people are living through the elderly age group, 60, 65 and above. Presently, I think we are 8%. So the numbers will increase. So elderly care, a lot of scope for integrated medicine. School health, again, because health promotion, and a lot of promotion component can come into young age so that the health risk behaviors are avoided and healthy practices are adopted by the population right from young age. Sports medicine, a lot of pain, injuries which can be managed by alternate systems. There is a program integration, and for mental health clearly, mindfulness, meditation, yoga, breathing, all that is, and there are multiple research projects being funded by ICMR and Ayush Council, and this press release actually lists a whole list in the election. So in summary, it's an inclusive model which we are looking at, okay? But evidence-based therapies from different systems. So equal benchmark for physical, mental, emotional and social well-being. And you know, one of our hidden agenda also would be that the doctor-patient relationship gets strengthened by using this combination approach. And government does support integrative in several healthcare settings, and IM is already commonly sought for lifestyle-related diseases and chronic conditions. So there is a demand as well. The general public also expects that there should be a possibility that their doctor is able to advise them appropriately. But we must practice ethically within the legal framework. That's non-negotiable. So we are looking at a patient-centered approach that informs, empowers, and allows the patients to choose confidently the integrative medicine. So it may be a counselor who does the first job of assessing, but I think as we move forward, it may be a good idea that the graduates of modern medicine also have some idea of the strengths of other systems. Therefore, when the government says that can we integrate the knowledge of traditional medicine within MBBS program, I think that's a forward-looking policy. But it is the field is full of landmines, because there is politics of professional rivalry. So the ideas clash, the understanding is poor, so it becomes a competitive rather than a complementary approach. Okay, so going forward, I think we have to evolve. The solution cannot be delivered in a half-cooked manner. We have to understand, and if the patient comes to me, how will I guide him or her to look for remedy in the alternate medicine, right? If I have not been trained, how would I do that? By WhatsApp University, that may be the commonest route of knowledge, but we have to make it more formal. So there are challenges, we are evolving, and I think the component of research added to integrative medicine and Venu is one of the way forwards to build the ship as we float. So let's do that. My best wishes, and thank you for your patience.
Thank you so for emphasizing that the epidemiological transition is taking place and how non-communicable diseases need alternate and holistic approach at a global level, and educating us that health is not just a mere absence of disease, but a state of complete social, mental, physical, and emotional well-being. The next speaker is Dr. Rajiv Mohan, who will talk about managing chronic eye diseases through integrative medicine. Dr. Mohan is the medical director at Venu Eye Institute and chairperson of the Ethics Committee and medical advisor at Venu Eye Institute and Research Center. I'd like to request Dr. Rajiv Mohan to deliver his words.
Good morning, everyone. I would like to thank Venu Institute and the board for inviting me to give a talk on ophthalmology with integrative medicine. I think Dr. Mehta has made my talk more difficult because your chat GPT did not mention ophthalmology as well, apart from gastro. So ophthalmology is missing from chat GPT. So really, I would like to have a special thanks for Tanujaji for putting me in this hotspot, trying to integrate integrative medicine with ophthalmology. So starting off, when I was asked to speak on this topic, I really didn't know how to start off, but Eat, Pray, Love came to my mind. Seeing the audience, I think many of you may have either read the book or seen the movie. It's by Elizabeth Gilbert, and when it came, that's maybe about 2 decades ago, I read the book because it was famous, everybody talked about it, so I read the book. And I like reading these kind of books. When the movie came, I saw it was of Julia Roberts. And so obviously Julia Roberts was a flame at that time. So it was a good movie that I saw, a good book that I read, and so be it. In the present time, when I look back at the book and the movie, I think it has a deeper meaning about self-preservation, self-resurrection, self-healing, and reinventing yourself. And that's why I felt that Eat, Pray, Love book and the movie would have a role to play in the present integrative medicine. So I picked up this slide from Google, obviously. Surprise, surprise, there is a, sorry, excuse me. Yeah, so there is a vision chart as well in this. Obviously somebody has given a talk on ophthalmology with the integrative medicine earlier, showing how everything can be merged together. Eyes are less than 1% of the body weight, but they give 80% of the sensory input. And I think that's a very, very important thing. जो हम कहते थे कि आंखों से सब कुछ बीमारियों के बारे में पता चल जाता है. Vision is not just about genetics or aging, it's also about lifestyle and nutrition. Eye health is a window to systemic health, like I said earlier. And goal is to understand how diet, health, holistic practices can protect vision with the help of integrative medicine. Some of my slides may be stepping onto the on the feet of other talkers, so I apologize for that. When you go on Google to check what's integrative medicine, it says integrative medicine means blending the best of conventional medicine with evidence-based complementary oblique naturopathic practices for disease prevention. Everybody would know this gentleman, obviously. So when I was in my teens and I was getting hold of my senses, I was exposed to nonsense. Now, Raji Desai ji was a patient of my father, late Dr. Harimohan, and we all knew he was fond of a particular drink. So auto-urine therapy was his forte, apart from politics. Obviously at that time, it was all thought to be absolute nonsense. Gaumutra sunata, manushya mutra kaun peeta hai? So, having said that, when I look back, I feel that maybe he was doing something in terms of naturopathy. Maybe not the right way, I don't know, maybe the right way. But obviously he was heading and strongly believed in a holistic approach to good health, which is why he lived up to 99. And lo and behold, he never had his cataracts done. He never had a cataract. Because from what I know from my father, he used to put his urine in his eyes as well, as eye drops. So he used to filter it with a muslin ke kapde se filter karke, he used to put it as eye drops. So at 99 he passed away with good vision and no cataracts. So I am forced to have some faith in integrative medicine. So what factors might be affecting vision in the present scenario? Obviously digitization is the first thing which comes to our mind. It causes reduced blinking, dry eyes, chronic redness in the eyes, burning sensation, eye strain, etc. The blue rays that emit from the screen are more than the sun rays in a day. So that's the kind of exposure we are exposed to in digitization world. Apart from digitization, the sleep pattern, which is quite badly affected, especially in the people who are working on the system for long hours. And with the world becoming smaller, they are working through the night. So poor sleep pattern would cause all kinds of twitching, burning sensation, etc. Lack of exercise, including eye exercises, is also a major reason for the eyes not feeling good or healthy. Smoking and alcohol, which is of course a lifestyle disease, impacting the whole body, I presume, including the eyes. It's well known that smoking and alcohol can propagate the development of cataract, glaucoma, and macular degeneration. So dietary habits as well, packaged food, fast food, impacts the overall health, which in turn impacts the eye as well. So really the goal is inner peace and outer clarity. So primarily our vision is impacted in three ways. apart from many other eye diseases, but I will just talk about cataract, macular degeneration, and glaucoma. Glaucoma is when the eye pressure goes up. Macular degeneration is where the back of the retina gets damaged, and cataract, of course, everybody knows. So, integrative strategies for cataract. Conventional measures could include managing your systemic disease, regular night checkups, avoiding smoking and alcohol. Nutrition and supplements, particularly antioxidants, they help to reduce the oxidative damage. Carotenoids, they accumulate in the lens and act as filters. The omega-3 fatty acids act as anti-inflammatory. Curcumin and amla, which is vitamin C. And rest assured, quite a few eye doctors actually give these supplements for eye problems. Yoga and meditation also helps. Pranayama, which is deep breathing, steady gazing, that is Trataka, and chanting Om. So people who do chant Om, you may have realized that there is a heavy concentration in the middle of your eyes and the forehead. And when the eyes are shut, you actually go into kind of a trance. These methodologies probably help in improving the microcirculation to the eyes and thereby strengthening the eye muscles. The herbal and traditional approaches can be Ayurveda, wherein we know a lot of people use Bifla and they dip their eyes into that katori, they dip their eyes. Bilberry and ginkgo biloba, they improve the ocular blood flow, and the green tea polyphenols, they protect the lens proteins. So whenever the lens proteins are protected, either by green tea polyphenols or any other filter, you reduce the chances of developing a cataract. What about macular degeneration? There is a study which is very famous, the age-related eye disease study, AREDS 1 and 2, and they have found that any formulation consisting of vitamin C, vitamin E, zinc, copper, lutein, zeaxanthin are helpful in slowing down macular degeneration. And this is very important, and this is a lot of our eye patients, especially the senior citizens, are given this supplement on a regular basis. As also people who are already suffering from macular degeneration, they too are asked to take this medication to try and reduce the slide of their vision. Meditation and yoga lowers the oxidative stress and inflammation. So when the stress is low, inflammation is low, eyes behave better. Obviously avoid excess alcohol and smoking. Processed foods I talked about earlier, avoid those as far as possible. What about glaucoma? Integrative medicine can help in glaucoma. There is a study done at AIMS RT Center where it is called the 365 methodology. 365 breathing technique states that 3 times per day, breathing rate of 6 cycles per minute for 5 minutes, alongside with your glaucoma medication, helps to reduce your eye pressure, especially for glaucoma patients. So this is a study that has been done in RT Center not too far back. So breathing in this way on a regular basis can help to reduce glaucoma. My sister actually, my elder sister, has glaucoma, and believe you me, I have experienced it umpteen times. She's on glaucoma medication, but whenever her stress levels are high, her pressure is high. And I'm quoting it over here because I've seen it happening. Whenever she's in a state of happy mood and joy, happiness, where she says, to hell with the word, her eye pressure is pretty normal. Of course, she has to continue the medication, but the happiness quotient matters. Integration with homeopathy as far as ophthalmology is concerned. Dr. Arvind is here with us, and many of our uveitis patients and patients with chalation, it's a lump on the lid. I do suggest to them that if you want to take homeopathic treatment, they can do so. And I'm sure there are many other diseases which I'm not aware of, which can be helped by the alternate medicine, including homeopathy, other than uveitis and collision that I often refer my patients for. Of course, they need to continue the allopathic medication because they can certainly opt for homeopathy at least. There are other holistic approaches to eye care. The lakh is the application of herbs on the closed eyelids. It uses herbal medicines to calm the irritation of the eyes, decreases burning sensation and possibly pain as well. Hydration, of course, everybody knows it's a good thing to do for the whole body. Palming, a lot of people do palming in the morning. We inadvertently take off our glasses and rub our eyes and do that, which is in a way palming. And palming relaxes the eyes a lot, it improves the blood. Primarily it is improving the blood circulation because of the heat. Brahmari pranayam, which is also called the hummingbee breath. And this exercise obviously again calms the mind. I'm talking not just ophthalmology, but in a general way. It reduces the eye strain and the tension and headache. Acupuncture improves the ocular blood flow. It can improve the microcirculation in retina and optic nerve. That's helpful in optic neuropathy. So there are a lot of acupuncturists who are treating optic neuropathy, which is where the optic nerve of the eye gets damaged. And I have personally seen some patients who have benefited to some extent. I think it's an alternate medicine which can be looked into. Acupressure, the foot reflexology is the middle finger. Sorry. The middle finger has the eye center, middle finger of the foot. Some of the eye drops that are very popular in India, Cineraria, Eye Tone, and ophthalmic by Himalaya. These are Ayurvedic based medicines, homeopathic based medicines. So Cineraria is homeopathic, Eye Tone, and I think are Ayurvedic based eye drops. Generally used for general purpose, for general eye care, health care, and they can possibly delay cataract progression. To some extent, I can vouch by that because I have a lot of patients. I have over 3 decades of practice, and there are many elderly people who have been putting Cineraria for donkeys of years as a routine, as a habit. And believe you me, when I look at their eyes and their age, their eyes do not compare with their age. They should have had a cataract, they don't have a cataract. So somewhere along the line, these medicines work. Help. They don't help immediately. Once you develop a cataract, you have it. But if you're an early starter in putting these drops, especially Cineraria, I've noticed it probably does delay the development of cataract. Diabetes and hypertension, we all know, is the commonest systemic diseases, and they can cause havoc in the eye. There's the kind of havoc happening in a diabetic patient, that's in a hypertensive patient. These are the worst scenarios I'm showing. But having said that, if diabetes and hypertension managed well holistically with integrative medicine will indirectly help the eye as well. Happiness quotient. I'm sure all of us know this chap, Bob Marley, or may have heard his song, Don't Worry, Be Happy. Obviously, happiness quotient is very important for all of us to balance our nerves and the hormone systems and enhances compliance. In conclusion, eye care is beyond spectacles and surgery. It is about lifestyle choices as well. Nutrition, exercise, healthy habits do help in long-lasting vision. Think of integrative eye care as giving your eyes both medicine and mindfulness, protecting your sight while keeping your lifestyle bright. Hakuna Matata, as they say. Thank you.
Thank you, sir, for educating us with the strategies adoption that will help prevent eye diseases or at least help delay the progression of the same. To talk about harnessing the power of breath in our daily life, it is my honor to call upon the dais Dr. Ashok Bhatt. Dr. Ashok Bhatt is an accomplished anesthesiologist and renowned breathworks consultant recognized for bridging the fields of modern medicine and yogic sciences. He is currently serving as a breathworks consultant and visiting faculty at the Indian Aviation Academy. So please deliver your kind words.
Especially grateful to Dr. Sheikh for giving me this opportunity. Sir, may I?
Yeah, please.
Harnessing the power of breath. My previous speakers have made things easy for me now. So I can take deep breaths easily. Otherwise I was slightly stressed. Breath is one thing which is lot of things are being done to connect the modern science with the ancient science. And best part is, if you try to see the science behind the techniques or breathing exercises, you will be able to appreciate, and not only appreciate, you will be able to get the benefits of the breathing. So let me start with few ancient quotes. This is a very great modern sage by the name of Swami Rama. And my request is, if any one of you get a chance, read his book, The Science of Breath by Swami Rama. It will give a lot of clarity to the importance of breathing. So you can never remain in joy and you can never be happy unless there is a perfect coordination between the breath and the mind. Swami Shivananda, you all know about him. Yogis, they measure the span of life by the number of breaths, not by the number of years. And another important thing is, you see, if anything happens to our physical body, our breath is the first one to get. If anything happens to our mental, if you are stressed because of any reason or we are emotionally upset, the first one thing to be affected is again your breath. See what happens whenever we are angry. We are unable to speak properly. You go to a doctor. Now see one of the important scenarios. You go to a doctor or go for vaccination. If you are afraid of injections, and what does the doctor say? Take deep breaths, take deep breaths, take deep breaths. And I think I may have assisted thousands of normal vaginal deliveries, which is supposed to be one of the most painful procedures on the earth. So there we teach them how to harness the power of breath to take care of the pain. So I have tried to highlight few basic facts, which if we can understand, then we will know the importance of why we need to do exercises regarding our breathing, why we need to focus so much on breath. Controlling thoughts, emotionally upset, you want to feel energetic, you are not having a good sleep. There is a common link in breath. Just by focusing on your breath, you can take charge of your life. All these things, they are very, And you will get the benefits once you start practicing, and you will see the benefits within a week's time. You don't have to wait for months and years. I always tell all my clients and patients whosoever come to me, if you are good at breathing practices, then you need to know managing the movement of your diaphragm. You may be doing pranayama for n number of years. Until unless you know how to take charge of your diaphragm, you will not be able to get, or you will not be able to maximize the benefits. So, we will start with a small, just to have a clarity. These are all basic things. Many of you know, many of my colleagues, senior colleagues, they are very well versed with all these things, but for the general public, just to have a clarity, this is the chest, this is the abdomen. There is a demarcation muscle, the muscle which divides the abdominal wall, abdominal cavity from the chest cavity, that is the diaphragm. It's a dome shaped. And the chest consists of two very important organs, two lungs and one heart. So this is the representation of these two are the lung. This is the diaphragm. You can see the orangish thing, this is the diaphragm. If you know how to take care of the movement of diaphragm, then you are going to get the maximum possible benefits from all the breathing exercises, including pranayama. I am very clear that there are no breathing exercises in the world which are not based on our ancient breathing exercises known by the name of pranayama. They may give you any name, they may give you box breathing, they may tell you, but what is box breathing? It is samavritti pranayama, nothing else. So, this is the fact number one. Why we need to focus so much on breathing exercises? The lungs have got no muscles in it. It's totally a plastic tissue, just like a rubber band or just like a balloon. So when you inhale, you are inflating the lungs. When you are exhaling, you are deflating the lungs. If you understand this, then you will know what is the importance, why we need to focus on breathing so much. You take a rubber band, you don't use the rubber band for a month. And if you use the rubber band after a month, as soon as you try to stretch the rubber band, it breaks. And if you keep using the rubber band on a daily basis, then you can really extend the life of the rubber band. That is the power of elasticity. Similarly, you need to focus on your breathing, simple exercises, so that you can maintain or maybe you can strengthen the elasticity of the lung. So this is why we need to focus so much on breathing exercise. Simple breathing exercise. Just taking deep breaths, deep inhalation and deep exhalation, that is good enough. Fact number 2. Respiratory rate in a lot of cases decides our lifespan. You learn from the nature. You see the pets. The respiratory rate is very high. They live for 10 years, 12 years, maximum 15. Elephant, respiratory rate is much better. Much better means lower level. They live for a longer period. Tortoise breathes once in a minute and lives for almost 200, 300 years. So if we can focus, if we can decrease our respiratory rate, that's the simplest thing. Somehow we can decrease the respiratory rate to maybe 10 or less than 10. Then you will not only find a lot of health issues being taken care, you will find that you are healthy and your lifespan really goes up. So how to decrease the respiratory rate? What is the respiratory rate? Respiratory rate is number of breath cycles in a minute. What is the breath cycle? One breath cycle is one inhalation plus exhalation. Simple. This is clear to all of you? When I breathe in, when I breathe out, that is the one breath cycle. So if you can, normally it is about 14 to 16 is the respiratory rate. That is, we breathe for about 14 to 16 times in a minute. So if we can decrease that rate to maybe 12, maybe 10, then we can take care of our health. A lot of health aspects you will see that they are taken care of, we can decrease mental health issues, physical health issues, and your lifespan. Just see, there is a very famous book by James Nestor, you must have read this. Breathing just 20% or even 10% more than the body's needs could overwork our systems. Eventually, they would weaken and falter. Was breathing too much making people sick and keeping them that way? So you have to think on those lines. Why we are focusing so much on that we need to decrease our breathing. For that you have to lengthen your inhalation or exhalation. Very simple. Respiratory rate will decrease when the breath cycles will be less in a minute. Less breath cycle means your inhalation and exhalation, they are getting lengthened. So two very simple ways I will just share with you. They are a very simple thing, and unfortunately we do them a lot of times in our day-to-day activity, but we are not incorporating them. You can speak only in exhalation. You can never speak in inhalation. And unfortunately, it has been seen that 70% of us have got a shorter exhalation. You go to a doctor, they ask you to take deep breath, you will focus on the inhalation. Do not focus on exhalation. So 70%. In fact, in my practice, I have seen almost more than 90% people are having shorter exhalation. So if we can simply lengthen the exhalation. There is a beautiful paper in 2019 which has come up in Psychology Today. It says just by lengthening your exhalation, you can hack into your nervous system. The nervous system is one thing which takes care of all the organs. Very simple. So you can speak only in exhalation. So that is the importance of humming breath. Dr. Mohan was talking about humming breath and Brahmari, deep breath. That is important. Till the time I am humming, I am lengthening my exhalation. I am being very scientific. There are other things which have been mentioned in the scriptures. I am not talking about that because you are all modern people. You want science behind everything. So just by lengthening your exhalation, you can take charge of your nervous system. Nervous system is the one thing. It is mother of all the systems. Whether it's gastroenterology system, cardiac system, pulmonary system, circulatory system, everything is being taken care of. If your nervous system is not working properly, then you will not get the benefits. So, how to have? Just by lengthening the exhalation. So, two simple ways. One is, that's why you see singers. They are all stress-free. There is another element. When your exhalation is lengthened, then you are activating parasympathetic nervous system, which is the relaxing part of the nervous system. And second technique is known as that is purse string breathing or straw breathing. You inhale through your nose, exhale through your mouth as if you are holding a straw. Very simple. So आपने शब्द सुना होगा जो लोग बजाते हैं और any of the flute and these instruments where you are exhaling, you are lengthening your exhalation. They are always healthy. They are always stress-free because they are knowingly or unknowingly they are able to take charge of your nervous system. Right. So this is one of the examples of straw breathing. This is humming breath, which I have talked about. So just try to focus, incorporate it into your lifestyle. You don't have to take half an hour in the morning or half an hour in the noon. You can do this while walking in the park. As simple as that. Incorporate these things into your lifestyle and get the benefits. Lot of queries which I get is what should be the inhalation-exhalation ratio. So I always tell, if you are tired, then go in for 2:1 breathing. Because if the inhalation is more, then you get a lot of oxygenation in the body. So if you are tired, let's say you have walked all through the day, you have gone to the home in the evening, you are feeling tired, just to feel energetic, you put more oxygen inside your body. How? Within the length of. Take deep breaths. And there is a beautiful book, I don't remember the Paul Neuroberg, I think, I don't remember the name of the author, on stress management. A lot of papers have been written which say that the best stress management is when the inhalation and exhalation are in the ratio of 1:1. That means length of inhalation is equal to length of exhalation. Length of breath cycle is not important. Even if it is 2 seconds inhalation, 2 seconds exhalation, that is good enough. So see the benefits of lengthening the, and if you want to deepen, if you want to take charge of your mental thoughts, if you want to deepen your spiritual journey, if you want to make your mind one-pointed, then 1:2 ratio is recommended. 1:2 means length of exhalation has to be twice the length of inhalation. So my suggestion is try to achieve a ratio of 1:1. That's very easy. Very easy. Fact number 3. Nasal breathing. I don't know whether you see podcast. There is a very famous author. I had told you the quotation of James Nestor. Not only him, a lot of people who are associated with breathing, they focus that you have to make sure consciously you have to keep breathing through your nose. Unfortunately, what happened? Because of dietary things, because of fast food or easily digestible things, chewing is hardly there. And when the chewing is not there, you are unable to maintain the arches of the palate inside the mouth, which in turn play havoc with the nasal passages. So you are unable to breathe properly. A lot of snorings are there because of the dietary habits. Apart from, of course, when the neck is short, uvula is big, tongue are big. Those are other examples, but commonly, you see, right from birth, we have started focusing on the fast food. And there is hardly any chewing. If you can just add awareness to your chewing, just awareness. Awareness means instead of chewing it for say 5 or 6 times, usually we do not chew for more than 8 times. If you can make it 16, 20, you will not only will enjoy the rasa of the food, you will be able to get the benefits of it. Fact number 4. That is, I was talking about the diaphragm. How to know that whether you are using diaphragm or not? Why we need to focus on diaphragm so much? Lungs, I have told you. The lower part of the lungs, they have got the maximum alveoli and maximum blood vessels. And there are basically 2 types of breathing. One is chest breathing. There are many types, but just to understand, there are 2 types. One is chest breathing, one is diaphragmatic breathing. Diaphragmatic breathing is also known as abdominal breathing or belly breathing. You can search the Google. When you are doing chest breathing, you are putting air in the upper half of the lungs, mainly. It's not that 100%. 70% air goes into the upper half, 30% goes into the lower half. When you are doing diaphragmatic breathing, when you are using diaphragm or when you are doing abdominal breathing, then you are putting air into the lower part of the lungs, which has got maximum alveoli and maximum blood vessels. So what is the net effect? Let's say if you are a chest breather. Normally 80% of us are chest breathers. My respiratory rate is 14 to 16 with chest breathing. I am comfortable. I am getting, let's say I require hypothetical, I require 500 ml of oxygen in a minute. And I am a chest breather. 14, I am breathing at a rate of 15 or 14 per minute. If I switch from chest breathing to a diaphragmatic breathing, because of the better oxygenation, because better ability to throw out the toxin, what happens? My respiratory rate immediately goes down. I am getting same amount of oxygen by breathing only 10 times or 12 times. That's the beauty. You don't have to make an effort. Just switching from chest breathing to the diaphragmatic breathing. How to find out whether you are a chest breather or abdominal breather? Simple. Closing your eyes, putting one arm on the chest, one arm on the abdomen. Just focus on the chest and the abdomen. See which one is moving more. If your chest is moving more as compared to the tummy, then you are a chest. If your tummy is moving more as compared to the chest, then you are using diaphragm. If there is a possibility that you are using both, that is also good. But you should try to use more of your diaphragm than the chest muscle. One very simple, see, this is abdominal breathing or diaphragmatic breathing. When I am breathing in, I am using my diaphragm. There is hardly any movement of chest. So mainly air is going into the lower part of the lungs. And when I am doing chest breathing, see what happens. Why this? Actually, this is the normal position of the diaphragm, relaxed position. So when I start breathing, it contracts. When it contracts, it pushes it flattens. It's a dome shape, it just flattens. When it flattens, it pushes the abdominal organ down, which in turn pushes the abdominal wall out. So net effect is, you can see this. I am using my diaphragm. When I am not using my diaphragm, see, there is no movement in and around the navel area. So you have to learn this art of using your diaphragm. It's just like a balloon. As soon as you start inflating the balloon, what happens? It goes to the lower part of the balloon. Similarly, your lungs are elastic tissue. You have to learn why you want to focus on this. Because of the blood vessels and alveoli. They are present in plenty in the lower part of the. So, one simple thing is, if you are unable to find out, if you are unable to deepen the diaphragm, just do this. When you take your arms above your head, when your chest wall, this gets tensed. You may not be able to move your chest. So you are using that. This you can do while lying down on the floor, while standing. When I am breathing, I am using that. This is a very simple exercise. This can be incorporated in your day-to-day activities. See, this is when I am using my chest. Unfortunately, when I am using my chest, see, the diaphragm, instead of going down, inhalation, it goes up. It juts into the lungs when I am doing chest breathing. But unfortunately, see any of the newborns, they only do diaphragmatic breathing. One reason is because these chest muscles are not well developed, but still they do this for 3 to 4 years. And after this, unfortunately, we make them so much stress that they shift from chest to abdominal to chest. See, this is how you should be doing belly out. When you inhale, the belly goes out. When you exhale, the belly goes in. Again, same type. These are the basic 2 types of breathing. Chest breathing, same thing which I have explained. Exercise is simple, I have told you. Simple. Second is you can twist. If I am twisting, I am increasing the intra-abdominal pressure. So basically, the diaphragm has to work more, just to strengthen. These are simple exercises which can be really incorporated into your lifestyle. Fortunately, I have been associated with making a module for the Airport Authority of India, air professionals. That is basically for air pilots, air traffic controllers and air hostesses. So I have incorporated these exercises for them because they don't have any space to do exercise. They just sit on the chair. So just by sitting on the chair, they can deepen their diaphragmatic breathing. Fact number 5. A lot of papers have been written. Number of respiratory rate decides the number of thoughts which are crossing your mind. Whenever you are stressed, the number of respiratory rate is very high. It's very difficult to take charge of your thoughts. It's easier to take charge of your breath. It's a grosser thing. So if you can just decrease your respiratory rate from 14 to 12 to 10 to 8, then you will find that a lot of calmness, quietude. That's why whenever you are having your friend, what do they say? They say, Don't worry, just take deep breaths. This is what they want. Basically, they want you to decrease the respiratory rate. There is another term which is very commonly used. This is heart rate variability. That's an indication of how stressed you are. If your heart rate variability is high, then you are less stressed. You are more prone to get happier. And if your heart rate variability, one of the reasons is if you can take charge of 1:1, if you can make it 1:1 breathing, or you can decrease the respiratory rate, then you can increase the heart rate variability. Lower heart rate variability is considered a sign of current or future health problems because it shows your body is less resilient and struggles to handle changing situations. It is also more common in people who have high resting heart rates. Your heart rate will go down, your blood pressure will go down as soon as you go in for 1:1 diaphragmatic breathing. This is often the case with conditions like diabetes, high blood pressure, heart arrhythmia, asthma, anxiety and depression. All the functions in the body are either voluntary or involuntary. Breathing is the only system which, though involuntary, you don't know, you don't remember you have been breathing since morning. But just by making it voluntary, by lengthening, voluntary means by lengthening inhalation, lengthening exhalation, becoming aware of your breath, you will get the benefits. Immediately you will find that you are becoming sense of quietude has descended on your mind. You become calm, have a lot of clarity. Because things around you are never going to change in this way. I can promise you that. Only thing, how you respond to that is going to, that is in your life. So one very simple thing is how to take charge of your breath. Last but not the least, one very important thing is breath awareness. When we are doing diaphragmatic breathing, we are focusing on the mechanics. Mechanics means length of inhalation, length of exhalation. There should be no jerkiness in your breath. But breath awareness is simply focusing on the process. What is breath? Being a witness to your breath. It's very easy to say, but it's very difficult to do. This is what is done in Vipassana. Just focusing on the inhalation, exhalation. You don't have to focus on the mechanics when you are doing breath awareness. You are focusing on the process. One simple way is just feel the touch of air inside the nostrils when you are breathing in and breathing out. That's it. You may feel slight coolness or slight warmth when you are exhaling, when coolness when you are exhaling. Or another way of doing breath awareness is when you are inhaling, feel and lungs are getting inflated. You just have to add awareness into your breath. That's it. So these are two very simple mechanisms which, if you can add, this is what I was telling. Diaphragmatic breathing is you are focusing on the mechanics. Mechanics means it should not be jerky. It has to be smooth, rhythmical breath. Length has to be 1:1 ratio at least, if not more. And you can incorporate. I will give you a simple example. Let's say you all go for the morning walk. 3 steps inhalation, 3 steps exhalation. That automatically becomes 1:1 breathing. Or if you are comfortable with that, you can lengthen the inhalation and exhalation by 4 steps inhalation, 4 steps exhalation. If you are still comfortable, make it. Try to lengthen. What happens? When you lengthen your inhalation and exhalation, your breath cycle lengthens. When your breath cycle lengthens, your respiratory rate goes down. And you are getting all the benefits without being dependent on anyone. It's an ATM. जेब से निकाला breathing. आप स्टैंड का कुछ नहीं करना. There is a boring presentation going on. You are sitting in the metro. Instead of scrolling the reels, focus on breath. It is said that just doing breath awareness for 2 minutes, there are chemical changes, they last for 2 hours. Positive chemical changes. So just think. You don't have to take half an hour in the morning, half an hour in the evening, because you people are very busy, you will never be able to take that time. So incorporate it to your lifestyle. Every 2 hours, just sit down, close your eyes, 2 minutes of diaphragmatic breathing or breath awareness, whatever you are comfortable with. Dan Brown, another very well-known author, I don't know whether you have just breathed, there's a book. By controlling our breath, we can willfully influence the brain and the autonomic nervous system and literally change our mind body state. By changing the pattern of our breathing, because breath is a grocer, you can change the pattern of your breath. It's very easy. You can become energetic, you can go into sleep just by changing your breathing patterns. By changing the pattern of our breathing, we change the pattern of information being sent to the brain. In other words, how often, how fast, and how much you inflate your lungs directly affects the brain and how it operates. When you breathe consciously, you activate a different part of the brain. That's a beautiful thing which is happening. As soon as you become aware of your breath, you activate that part of the nervous system, that part of the brain which is the most refined, cortex. The fix is easy. James Nestor says, breathe less, but that's harder than it sounds. We have become conditioned to breathe too much, just as we have been conditioned to eat too much. With some effort and training, our breathing less can become an unconscious habit. If you need to control yourself, your mind, body, emotions, or behavior, then start by controlling your breathing. These are the references. Thank you very much.
Thank you, sir, for emphasizing the role of conscious respiration and the strategies for longevity. As we are running short of time, we'll have question and answer session over the tea break. As we proceed further for the distribution of mementos, I would like to request Ms. Sujaya Krishnan ma'am to felicitate Dr. Ashok Sharma sir. Thank you, ma'am. I request for a huge round of applause. I now request Ms. Sumedha Sen ma'am to felicitate Dr. Vinod Batra sir. I would request Dr. Rajan Garyog sir to felicitate Dr. Ashwini Seth sir. In the meantime, I would request you all to please have a huge round of applause.
I'm told these are medicinal plants. This is insulin plant.
I would request Mr. Tarun Basu sir to felicitate Dr. Rajesh Mehta sir. I would request Ms. Tanuja Joshi ma'am to felicitate Dr. Rajiv Mohan sir. I would request Dr. Ashwini Seth sir to felicitate Dr. Ashok Bhatt sir. Let's have a huge round of applause. To conclude this session, session, I would like to request the chairperson to speak a few words.
First of all, I want to thank the management, the board of this famous institute, Dr. Ashwini Setia and Dr. Rajan Gadeo, who have organized this wonderful session. And I'm sure everybody agrees that we had such kind of knowledge in this last 1 and 2 hours that we were not really aware that what kind of things are happening in this integrative medicine field, which is being so much confessed. Now, I have 1 or 2 points to make that, while we are talking of integrative medicine, which is combining conventional and complementary therapies for overall well-being of patients, we have to be aware that, as somebody in the earlier part, Dr. Mehta, that even in the times, thousands of years ago, we had these therapies available. When Charak and Raj were there, they used to. We really don't know why they were left behind. And today's medicine took over in such a ferocious manner that we really do not know. Earlier, I'm sure, when we were children, our Dadi used to say that isme haldi dal do and this will be very good. Or applying some medicinal plant like what Dr. Ashwini said, that you rub that, you just put it there and the pain will go away. And this kind of patties were being done at those times. But over the years, we have gone so fast in the conventional nowadays, whatever being practiced, the allopathic system of medicine, that we have forgotten those. So I think it is the need of the hour that we develop faith of our patients in the medicine which was the medicine practiced by our forefathers and the Rishi Munis, and this homeopathy, yoga. What Dr. Bhatt was saying about this breathing. Breathing is such a thing that it has been there for years together. You see, even singers who sing very high notes like Muhammad Rafi and all, they used to have these kind of breathing exercises. Otherwise, they cannot go on to the notes like Man Tarpat, Hari Darshan Goaj and all those great songs. So we have forgotten somewhere. So that has to be emphasized to build faith of the public in this kind of medicine. The second thing is there has to be more research which has never been done. You see, the United States is coming with Ozempic and there's other medicines to reduce obesity and the kind of Monjaro and all those things. But we have hardly developed any kind of research module in this. So the government, of course, we have government officials and Dr. Mehta, of course, is world official, in a way, that somebody has to take care of developing that kind of research modules so that people have more faith in that. And third thing is that we have to have control on application. Now everybody is becoming a homeopath, you see. If he has done maybe 1 month course, he becomes a homeopath and he starts treating. So we got to have, if we have the Bachelor of Medicine, then we have the Doctorate of Medicine, EM, then we have, and so on. Then similarly, we should have the schools or the colleges which should be teaching this kind of a thing and then giving degrees which are accepted by the general public, so that they can, integrate the whole thing. If we have a physician, doctor is a diabetologist or he is an endocrinologist, if he is treating a patient of hypothyroidism or maybe a very severe diabetes, then the counterpart in the parallel group of medicine also should have that kind of a faith, and the people should have faith in that, then I'll be treated. Otherwise, you see, then the things cannot really be practiced. So this is as far as the first part is concerned. The breathing, what Dr. Bhatt talked about, this was wonderful. I'm really, because you see, when we walk in the evening, we also say that we have to make steps and that in that inhaling we should cross more steps, and it is really very invigorating. As far as Dr. Mohan's talk was concerned, very important. I have had also a little education in ophthalmology. When I joined earlier, I would have been an ophthalmologist at one point of time when I joined MS in BGI, Chandigarh, but I left that. Tell me that do you have any statistics on how many people have been in the field of glaucoma or cataract, that you have prescribed certain things like what you mentioned, and for treatment of AMD particularly, have you got that you have been able to treat the patients? You can prevent. You might say that do this thing, and the AMD will not happen, or the cataract will be delayed if you put urine or whatever it is, the kind of thing, and it will not develop. But if persons who come to you, they are not normal people. For preventive they come for treatment. So you must be getting people with early senile cataract or immature cataract, and nowadays you are operating immature cataracts also. You say that it's depending on how much you see.
Yeah,
so what is your experience on that you decide that not to operate and do this thing only, putting eye tone or senile area or whatever, and particularly in AMD, because we as physicians, when we have diabetics and non-diabetics, people when we get their retina checked and they have vision deterioration, and it is turned out to be AMD, and people are given intraretinal or subretinal injections, and they are not given anything else by yellow pad. So what is your experience, and what do you do in those cases? In glaucoma, it's good because you said that somebody is singing or is happy, that the tension goes down. But the diurnal variation of the intraocular tension is as it is there. You see, the pressure changes during different times of the day for various reasons, I don't know. Can you just throw a light on that for my benefit? Thank you. And thank you very much.
Thank you, Dr. Bhatta, for raising some very valid, interesting points. Starting with cataract, if a patient comes with an early cataract formation, from allopathic point of view, obviously there is no medicine that we can prescribe. When I showed slides of cineraria or eye tone, there's a drop called catalin and ophthalmic. These especially cineraria, it is out of, I cannot prescribe it. So if a patient comes to me with a cataract, they have it. If it's in the early stages, I do tell them to wait unless it's bothering their vision. If it is bothering their vision, yes, early cataracts are operated. So for example, a person who is a pilot and has got a very early cataract needs quality vision. You can't wait for for donkeys of years for a pilot. So from an allopathic point of view, what we do in our practice is, if a patient is already putting some drops, which are any of those drops which they feel is helping them in any way, we don't stop them from using. But having said that, if there is a cataract, I just allow them to wait if it's in the early stages. And obviously I can't write these drops. I don't write these drops, to be honest, because they are not part of my allopathic training. So I cannot prescribe them. But those who are already putting on their own, which are available over the counter, so they can carry on. And I have just seen over the years, having put these drops for over years, not months, but years, it has some benefit. So really there is no statistics to this, none whatsoever. The very fact that ChatGPT doesn't even take ophthalmology into account speaks volumes. Yeah, sometimes one at a time. Talking about AMD, the primary treatment for AMD is of two types, dry and wet. For dry, there is no treatment except you can take the multivitals, which I showed you, the AERDS study, which showed that a combination of these elements helps in controlling the macular degeneration, and that is for the dry kind. The wet kind needs injections. So you talked about the injection being given. That is the standard format worldwide to give injections for the wet kind of ARND. In the wet kind, multivitamins have limited role, very little role actually. And statistically, in terms of the injections being given, I would say 7 on 10 benefit. So there is a definitive treatment. How does holistic treatment help in controlling macular degeneration per se? There are no statistics, there are no studies. But I think overall patient well-being, and when the patients come back and say, okay, yes, I'm feeling better, that's good enough for us. That is good enough. We are not trying to cure them with holistic treatment. We are trying to help them to feel good. And I think we should draw the line there. Statistically, I would say, in terms of multivitamins, all of us must be on multivitamins. So am I. And I really don't know why we are taking them many a times. Many times we just take it because we heard from the neighbor. It's that way. There are no statistics to that. Coming to glaucoma, yes, there is a diurnal variation. So diurnal variation is like the blood pressure varies from morning to night. It varies when you're sleeping, when you're sitting, when you're walking. So the blood pressure varies. Similarly, the eye pressure varies from morning to night. And that's what Dr. Lakh talked about, diurnal variation. Now the diurnal variation in a normal person is not much. It is there, but not much. And in the present day and format, diurnal variation has very little role in management of glaucoma. There was a time, 30 years back, 40, 50 years back, where diurnal variation patients को पूरा दिन hospital में admit करके eye pressure check करते रहते थे every 1 hour. That's done away with donkeys of years back. So diurnal variation now has very little role to play in the management of glaucoma. So if you talk about management of glaucoma, it is obviously medication, definitely, but you can supplement it with a piece of joy.
Just to point, there have been a lot of patients or doctors who are practicing holistic medicine, and particularly homeopathy. They tend to advise medicines which are homeopathic medicines. My voice is pretty good. So the medicines are being prescribed for, like you said, glazion, sty, and even to patients. You know that the cataract predominance is there in sandy areas. In the field of, let's say, Rajasthan, in sandy areas, they develop cataract much faster. So homeopaths, they are prescribing, and we don't have anything to really support that. So what is your opinion on that?
Well, in my opinion, if the homeopath feels that he can help a patient, why not?
But
I'm not a judge. I'm not a judge.
Happy.
Honestly, I'm not a judge to that. As to why a homeopath is giving a certain medicine in Rajasthan. Does it help you in any way? No, it doesn't. There are no statistics there. I would leave that subject for Dr. Arvind to answer. Well, he's the expert here. But personally, if you ask me, if a patient is taking some homeopathic medicine or an eye drop where the homeopath is given for certain eye disease, I really have not seen any adverse reaction.
I just mentioned, like you mentioned glazion. Glazion is, I haven't seen a person coming unless you curate that out. Nothing comes out.
No, I don't find that. Dr. Arvind is here. I have seen patients getting cured by homeopathy for palliation and have avoided surgery. I have advised surgery. I have told them to take try homeopathy, and they have benefit.
Yeah, that's right. That is
Definitely.
It disappears at its own.
Well,
Sometimes.
now that's a debate in itself.
Thank you.
Thank you, sir. So as we are running short of time, we'll have the question and answer session over the tea break. I'd request Dr. Ashok Sharma sir to speak a few words.
First of all, thank you for calling me. I think we've had a very informative discussion. When Ashwini invited me to chair a session, my first reaction was, how do I chair a session about which I don't know anything? But having been for the last couple of hours, I think I have been informed. I'm not sure what the audience feels, but I'll leave it for the audience, and I think if any of you have any questions, I think it's your time to ask questions. So if there's anybody in the audience, that after tea. Over the tea.
Over the tea.
Where is the tea? That's a good idea.
So the answer to where is the tea? So the tea is served at the diagnostics area. I request all the guests to kindly proceed there. We have volunteers here who will guide you through. Dr. Vanita is a senior consultant radiology and has extensive clinical academic exposure at the leading international institutes. May I have a huge round of applause for Dr. Vanita Kapoor. Dr. Atul Prasad is the Vice Chairman and Head of the Department at BLK Max Super Speciality Hospital, New Delhi. I request a huge round of applause for Dr. Atul Prasad. So the first speaker, next on, we have a distinguished speaker, Dr. Deepak Singh, whose focus will be on evidence-based naturopathy, bridging tradition and modern healthcare. Dr. Singh is a naturopathy and yogic sciences specialist, currently working as senior consultant at Venu Naturopathy Center. He also holds a rich experience across leading wellness centers. I'd like to have him on the dais with a huge round of applause.
Healthy good morning, everyone, all the senior doctors, and the respected delegates and chairperson. I am Dr. Deepak, naturopathy physician, recently working in a Venu naturopathy care. It's truly honorable to be speaking in front of the such experienced and knowledgeable doctors in the audience. As we know, the medical science is evolving and the research is going on all the aspects in the integrated, in the modern medicine, naturopathy and Ayurveda. We believe we work together and enhance the healthcare system in the future. So today I'm going to represent about the evidence-based naturopathy and how the naturopathy is working in the healthcare system. So first of all, what is a naturopathy? We believe naturopathy is an inherent capacity of the body which is working on a healing capacity. Healing capacity is like in every system we call a vital energy, some system called a prana energy, some system called a Chinese medicine called a chi energy. And in naturopathy we call the vital energy which is an inherent force of the body which increases the vitality, our immune system, everything. So like in a pandemic reason we all know with the sides of the modern medicines, we are doing in home we are doing the naturopathy like nasal irrigation, pranayama, hot fermentation, some kadas we are drinking to increasing the immunity. So these are some research-based papers and something which increases the immunities. Like everyone is saying about the symptoms, but we are treating the root cause of the diseases. We believe like every human system have an ability which decrease the like a demonetization of the body and the diseases. Like germs do not cause a disease but present in a disease condition. So due to some researches and what is the evidence-based naturopathy is needed, evidence during the pandemic reason or now are going in the phases, so many people are going in the faith in the evidence-based naturopathy like homeopathy, chiropractic, acupuncture. These are growing nowadays. Like we are saying about 10 years, the ratio of the believing in these pathies are increases very frequently. The patients seeking very for the holistic approach, research-based themes they are seen. The clinical studies are based on the we are saying we are balancing the providing the mud therapy, hydrotherapy, acupuncture, yoga, diet, holistic approach we are providing the people for treating the diseases. Like firstly, we believe in a Panch Mahabhut. Everyone I think know about the Panch Mahabhut. Like in modern medicine and Ayurveda, we are seeing the body is made from the 5 elements, the air, water, ether, earth element and the water element. So any imbalances created between these, we got the diseases. So in naturopathy, we are treating the people with the help of these systems. Like a hydrotherapy, we are giving a spine bath, mud bath, we are giving the acupuncture, hip bath with the different temperatures and the variable temperature according to the patient need and the completion. So these are some research papers which shows how the naturopathy is giving the effect, the complementary with the modern medicines. So these are the international research papers. So I am giving in a summarized form. When we apply hot application for the diabetic patients, so after the application, the hot application affect glycemic control by regulating the heat stroke protein. So what is a heat stroke protein? That body is going to expose more than the 40-degree temperature, our defense system producing the heat stroke protein, which increase the insulin sensitivity and also reduce the inflammatory signaling. And same as when we are exposing the hot temperature on the body, our body's skin producing the nitric oxide, which increase the vasodilation of body, which reduce the sweating from the body for temperature regulation, like thermoregulation we all know. And the same as that, we apply the cold application for the body. The browning of adipose tissue is primarily responsible for the non-shivering thermoregulation facilitated by the cold application on the body. Promoting glucose transport, translocation, increase the visceral circulation resulting in the closure of ATP, sensitive potassium channels and the calcium channel also. And when we apply a cold application for the periphery, our peripheral muscle is going to constricted, and the inner we have a dilation which increases the blood flow in our internal organ. These are the common practices we are performing for the diabetic patient. Like for the pancreatic reason, we are applying a hot and cold, which increases the blood flow in the pancreas for the increasing the insulin sensitivity. And these are some reports of my recent patients. By giving a naturopathy and dietary changes to the patient, the HbA1c from 9.2 to 7.3 is reduced within 3 months. And these are the creatinine value, which is reduced from 2.5 to 1.9. So what's happened when tradition meets modernity? All we know that traditional naturopathy in Ayurveda is how effective for our body. When we compile with the modern medicine, it's very effective for the holistic approach and the modern medicine and the healthcare. Benefit of integrated naturopathy. What is the integrated naturopathy benefits? So when we apply a naturopathy in the integrated department, it's basically side effect free. It's giving a holistic approach to the patient, enhance the quality of the life in a chronic disease management, preventive and promotion of approach to the health. So what is the role of integrated naturopathy in the integrated department from the side of the Venu? In the future, we are going to do more research and collaboration for the therapies. We are going to train the therapist and the next generation practitioner, accessible care model for driving communication. So global shift, how the global shifting toward the integrated medicine, these are some research-based data. WHO endeavors a traditional and the complementary medicine integration, growing adaptation for the Europe. Nowadays, so many European countries and American associations also applying a chiropractor, acupuncturist, Ayurveda, naturopathy, hydrotherapy, and the patient integrated safer combined for the models. Future directions, more clinical research and studies is evident.
A very good afternoon to all of you friends, and thank you for giving me the honor and privilege to speak before you. Homeopathy, an essential adjuvant therapy that works. Homeopathic therapeutics is not an adversary, but rather a useful complement to modern medicine, an important adjuvant to mainstay treatment. For decades, the erroneous belief that one particular system of medicine is the only and ultimate one which works is fast losing ground. In today's day and age, a judicious, multi-pronged, integrated, synergistic approach, realizing the benefits and limitations, the advantages and drawbacks, and thus their utility in treating illness and sickness is the need of the hour and the viable future of medicine. The question which comes to mind is of what role would homeopathy play in an integrated approach? Homeopathy offers a safe, effective, gentle and sustained holistic method of treating diseases and curing illnesses. Not only is it cost effective, but it's beneficial and safe in a number of chronic ailments. Chronic allergies, skin conditions, upper respiratory tract infections, chronic sinusitis, allergic rhinitis, bronchitis, asthma are some examples. It is, however, imperative to note that each system of therapeutics has its own limitations to treatment, and to take cognizance of that fact and ascertain how much can be treated to the extent of the pathology. A multifaceted approach, taking into account the advantages of the different systems of medicine and utilizing them in an integrated manner, thus is the right way forward. As no one system is a panacea or end-all of treatment, it's wise to know its limitations as well. Next. In homeopathy tool, which is touted as a very useful tool or approach in dissolving kidney stones and some ureteric stones, there's one medicine called Berberis vulgaris, which is often used. There are limitations to the stone that can be dissolved or passed out. For example, a huge staghorn calculus, about 18 millimeters, spiculated, irregular, obstructing, causing obstruction, hydroureter, hydronephrosis, will definitely not be dissolved with homeopathic medicine, and a surgical intervention is a must. Thus, homeopathy offers a safe, viable therapeutic tool in some conditions like chronic allergies. Do we have the stone slide, please? Stone slide, yeah. I'm sorry, I just come back to the slide. This person had passed out on the stone, but I think I forgot to tell him or inquire whether he'd adequately washed his hand before retrieving the stone. So, homeopathy in chronic allergies, the idea is to reduce the chronicity, severity and recurrences so that flare-ups are minimal. Atopic dermatitis, rhinitis, sinusitis, adenoiditis and tonsillitis in children. Even chronic skin ailments, for example, eczemas, atopic dermatitis, verrucae, warts, skin tags, keloids, chalaziae as mentioned, homeopathic medicines have definitely helped to get rid of these. Next slide. These are some of the areas where homeopathy in skin conditions is known to help. These are the case of atopic dermatitis with the before-after thing, improvement after treatment, constitutional treatment, and there's another. This is a case of warts, multiple warts which have been earlier cauterized on the foot, but after treatment, luckily, they all disappeared. And this is again a case of warts. The gentleman had multiple warts on his beard area, which had been cauterized earlier, and then finally he got rid of them. And there's a smile on his, thankful smile on his face after his clean face. Even in conditions like androgenic alopecia, alopecia areata, vitiligo, psoriasis, homeopathy has a definite role to play. This is alopecia areata. It was almost alopecia totalis to begin with, but with treatment, the lady has a good growth of hair and now doesn't take any medicine because she doesn't need any. Even in vitiligo, this is again a case of psoriasis where there is definite improvement, and it took a little while, but the girl is much better. Vitiligo, again, similarly, since they are autoimmune conditions, we do not only prescribe for the skin, but for the person's natural immune system to modulate the immune system as a whole, to correct the aberrant immune response, which is targeting their own tissues. In fact, A lot of doctors bring in their children to be treated homeopathically to prevent recurrences of problems like tonsillitis, rhinitis, otitis media, etc., to avoid the overuse of antibiotics for acute cases and the fear of being dependent on them. And another area of interest, these are the childhood conditions, another area of interest in homeopathy's role is in autism and Asperger's syndrome, where we know that there is no known cure being a genetic anomaly, but medicines are known to help the child's individual social interactive skills, concentration, and hyperactivity. A lot is talked about a good gut health, who no one better than Dr. Ashwini Sethia can talk about, but many homeopathic remedies work excellently in promoting digestion, helping liver function. Remedies like Kalme, Chelidonium are just to name a few. Again, where homeopathy does not help is in dissolving gallbladder stones, unlike in kidney stones. Much to the despair and disdain of patients who come in with a lot of hope, hoping that surgery could be avoided, but are in turn referred back to gastroenterologists for their invaluable opinion and advice. In an area of injuries and trauma, there is a wonderful medicine used in homeopathy called Arnica montana. The extract of the leaves of this tree is extremely beneficial in healing of soft tissue injuries, even bones and fractures. It is now being utilized by many surgeons abroad to expedite healing post-surgery. Another plant, Symphytum officinae, is given for fracture healing. It's been known to lay down new bone where fractures have happened. In fact, in folklore, it's called bone setter. Homeopathy shows promising results in treating anxiety disorders as well. We have on record a lot of patients, younger patients, older ones, presenting with a lot of anxiety symptoms, anticipatory anxiety, performance-oriented anxiety before exams, vivas, interviews, and one medicine called Califos and another called Argentum nitricum have been used very, very effectively and beneficially. The anticipatory anxiety, performance anxiety can also be seen in boardrooms, and it's used there also. So, in its, pardon the pun, in its essence, homeopathy treats not only the disease condition, but the patient holistically, and the approach is a constitutional totality-based approach. So it's important to note not only of the patient's symptoms, his diagnosis, etc., which is important, but also know about the patient as an individual, his psyche, his likes, his dislikes, his mental, emotional makeup. Here, a comprehensive, painstaking, and detailed history of the person being treated becomes of paramount importance. Thank God I have a very dedicated team who does that, but it becomes very important. The patient in turn feels more satiated, comfortable, and he or she feels that they've been duly heard by the doctor. Interestingly, diagnosis, lab parameters, tests, x-rays, scans are of equal value in ascertaining the diagnosis, prognosis of the disease and its progression. This remains true in homeopathy as well, contrary to belief of some practitioners. Another area where homeopathy has helped and benefited include non-healing wounds, ulcers, abscesses, keloids, where earlier a lot of antibiotics and steroids have been previously prescribed, but with recurrences. Even in chronic relapsing infections or recurrent infections like recurrent urinary tract infection, where earlier antibiotics allay the infection, but there is recurrence, again because of drug resistance or bacterial mutation, homeopathic medicines like Cantharis and Chimaphila work wonders for preventing relapses. In patients with malignancies too being treated on chemotherapy, homeopathic medicines are an invaluable support to help their already compromised immune system. stimulate WBC production, and to minimize side effects like nausea, vomiting, loss of appetite, pain, fatigue, and hair loss. The gamut of areas where homeopathy is used is chronic anemia, menstrual irregularities, polycystic ovarian disease, acne, and IBS, and the list goes on. Even in veterinary medicine, for example, dogs with painful stones, kidney stones presenting with dysuria, hematuria, we've been able to help with medicines like Berberis vulgaris and hydrangea, the purple, pink, white flowers that adorn the bushes in the mountains, and they've helped pass out stones. We have on record patients Bolu, Rocky, Caesar, Badal, Bijli, Juno, who are dogs. Another area of interest and importance is that homeopathy is safely prescribed even in pregnancy and during lactation for various concomitant conditions like excessive nausea, vomiting, morning sickness, that is hyperemesis gravidarum, and also as a galactogore to promote the flow of milk in lactating mothers. Since they are not chemicals, drugs, hormones, etc., nor do they cross the placental barrier or nor are excreted in milk, they are safely given. One plant extract is called Symphoricarpus racemosa, and this is given to reduce the nausea and emesis in pregnancy. Another, Ricinus communis, helps in promoting lactation. Some patients, even doctors, approach the homeopathic treatment with a great degree of skepticism and disbelief, which is understandable, as they don't know about homeopathic remedies, their names, etc. The action of these ultracellular doses is also not well stated or documented in a language or jargon which is familiar to them. One plausible reason for this anomaly is the paucity of research at a microcellular level and the funds to do so. However, this is fast changing, with France taking pioneer steps in this direction, documenting, analyzing and reproducing the results of research, and thus we get a database for us to work on. Talking about skepticism, one such skeptical patient came into our clinic one morning after having visited the urologist the evening before for the treatment of his prostate enlargement or benign prostatic hypertrophy. The urologist had advised an ultimate surgery, but felt that there was no urgency in it, as his PSA was normal, his residual bladder volume was within normal limits, his urochrometry was within normal limits. The patient inquired, "Sir, how do you examine the prostate gland in homeopathy?" I couldn't resist and said that in homeopathy, we take a silver spoon with a shiny surface, put it in the mouth and ask you to say, "Ah." His expression was aghast, and eventually I couldn't control my laughter and explained to him that apart from an ultrasound, CT scan, a digital PR examination, there was no other way to find out what it was. There are some common myths about homeopathy which I'd like to dispel. Number one, that it can't be given to patients who are on conventional allopathic treatment. False. Homeopathy can be safely instituted as an invaluable support and to complement conventional treatment with the main aim to diminish relapses and the chronicity of disease. Myth number two, that you can't eat onions, garlics, or have coffee with homeopathy. Not true. Onions, garlic, coffee can definitely be had when taking homeopathic medicines, with the only caveat being that they are spaced about half an hour from the time of consumption of these, because these are strong smelling, have a pungent aftertaste, and coat the lining of the mouth. Since all homeopathic medicines are absorbed from the lining of the mouth, the buccal mucosa, we don't want anything lining the coating of the mouth for a short while before the medicine is consumed. Of course, anything in excess like coffee, tea, which are stimulants, are best avoided. Third, homeopathy first exacerbates or increases symptoms to cure disease. First you cause bronchospasm, and then cure the problem. False. Homeopathic remedies do not increase symptoms initially as thought. The only exception to this is in wet eczemas, where patients are already on topical steroid ointments to keep the eczema under check, and when they are asked to discontinue topical applications, there is a flare-up, there is oozing, lot of discharge, then the flake, scab formation, eventually drying up. So this is the only condition where they attribute it to bringing out the symptoms. Another myth which is of very significance, great significance and importance, that homeopathic medicines may have steroids, especially if they work fast or quickly. The answer to steroids in homeopathy is a categoric and emphatic no. Although some plant extracts may have naturally occurring steroids. Many times we've been asked that, and homeopathic medicines, my skeptic patients were tested and they said that they showed presence of steroids. We did a further analysis and found out that a common test done to this effect to find out the presence of steroids in medicines is known as the Tauridine blue test, where a bluish purple ring is imparted to a solvent if there are steroids present in the solvent. On further analysis and finding out that it was due not to the steroid, but the blue-purple ring was on account of the sugar, sucrose, which is inherently present in globules used in homeopathy or pills used in homeopathy. The most confirmatory and the only reliable way to test for steroids for any medicine, drug, etc. is the paper chromatography test, which is a lot more expensive, takes about a week to give accurate and true results. And this is done in a few good laboratories, one of them being the VIIMR Institute of Industrial Research, Delhi University Civil Lines. None of the 120 samples we sent on our own behalf showed positive steroids. In conclusion, I firmly believe that homeopathy is an invaluable and pertinent asset and an adjunct to other therapeutics. I would like to thank my young team, dedicated associates, Dr. Anjali, Dr. Kancha, Dr. Sangeeta, Sumita, for helping me prepare this PPT. I didn't even know the meaning of PPT, and they educated me and egged me on to speak. Last but not the least, I would sincerely like to thank my dear esteemed friend, Dr. Ashwini Seth, who thought it worthy of me to be able to speak before you. Thank you all for being patient and hearing me out and not being too bored to fall asleep. Thank you.
Thank you so much, sir. It feels so good to see patients heal and how homeopathy as an adjunct therapy works, not just for treating local diseases, but treating the patient entirely. The next speaker is Dr. Venu Charitable. She is a distinguished expert in Ayurvedic medicine with more than 26 years of clinical, academic and research experience. She is currently Chief of Services, Head of the Department and Senior Ayurveda Consultant at Holy Family Hospital, New Delhi. I request ma'am's presence on the dais.
At the onset, let me thank you to the organizers, persons, and especially Dr. Ashwini Seth for inviting me here to give my views and to give my speech here for talk here regarding Ayurveda. And I would like to start with the special breath work, which is Saraswati Vandana. तुषार हार धवला दैवै सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा। जय जगन्नाथ। So what's the health as per Ayurveda? It's defined in only one shloka, that too around 3000 years back in Sushruta Samhita. The chapter and verse, the reference is there. It says samadosha samadvishya samadhatu malakriya prasannatme indriye mana swast ityabhidhiyate. What it says? It says any person who is healthy must have their doshas, their biological doshas should be in equilibrium, then Agni, their metabolism, their digestion, and the complete system, digestive and metabolic system should be same, should be in equilibrium. Then Samadhatu, there are 7 dhatus described in Ayurveda, Ras, Rakt, Mans, Med, Asti, Majja, Shukra. They should be all in equilibrium. And Malakriya, there are 3 malas described in Ayurveda, Svet, Mutra and Purish. They are all the 3 excretory systems, all should be very, very fine. And Prasannatme Indriye Manaha, their health, their mental health, their emotional health, their spiritual health, they have emphasized on. And the physical, basically in short what they have told, the complete physical health and the emotional and mental and spiritual health they have emphasized upon. So now we can visualize the vision of those sages, those rishis 3000 years back who have given this definition of health, which have been as it is described by WHO as well. So we can see that. So we can see this Ayurveda, how holistic it is and how holistically work it is, and it believes in treating holistical treatment of any individual and not the disease. So आयुर्वेद ये कहता है कि हमें एक डिजीज की चिकित्सा नहीं करनी है, हमें एक रोगी की, एक पर्सन की, एक व्यक्ति की चिकित्सा करनी है। इस तरह से हमें आगे बढ़ना है। और aim of Ayurveda is what? Ayurveda is Indian, as we all know, Ayurveda is an Indian medical science. जो इंडिया में ही ओरिजिन हुआ है, इंडिया से ही बाहर कहीं भी गया है, वो इंडिया से ही गया है। तो ये कहता है स्वास्थ्य से स्वास्थ्य रक्षण। देयर आर 2 aims. सबसे पहला क्या एम है? स्वास्थ्य से स्वास्थ्य रक्षण। मेन एम इज टू मेंटेन हेल्थ ऑफ एनी हेल्दी इंडिविजुअल। जो भी हेल्दी है उसको हेल्थ को मेंटेन करना। वो कैसे करना है? वो डाइट से करना है, वो लाइफस्टाइल से करना है, और वो उनकी रूटीन से करना है। और जिसके लिए मैं आपको आगे बताऊंगी कि उन्होंने क्या क्या बताया है हेल्थ को मेंटेन करने के लिए। दे हैव एक्सप्लेन्ड n number of things for maintaining the health. And then if unfortunately अगर उसको कोई प्रॉब्लम आ जाती है तो उसका सेकेंड एम क्या है? आतुरस्य विकार प्रशमनम च। अगर वो बीमार हो गया है, आतुर है, बीमार हो गया है, उसको व्याधि हो गई है, डिजीज हो गई है, उसके विकार को, उसके डिजीज को प्रशमन करना, उसको ठीक करना, दैट इज द सेम सेकेंड एम ऑफ आयुर्वेदा. So these are the 2 main aims, and we can see the holistic nature of Ayurveda by seeing these 2 aims. कि एक तो सबसे पहले स्वस्थ व्यक्ति के स्वास्थ्य को मेंटेन करना, दैट इज द मेन. अभी जो है अष्टांग आयुर्वेद, आयुर्वेदा हैज 8 लिंग्स. अष्टांग आयुर्वेद में जिसमें इन्होंने बोला है कि इंटरनल मेडिसिन है, शालक्य तंत्र भी है, अगर तंत्र टॉक्सिकोलॉजी भी है, शल्य सर्जरी भी है. सर्जरी में बहुत ज़्यादा एडवांसमेंट नहीं हुई है क्योंकि आयुर्वेद जो है वो अभी इवॉल्विंग है शल्य में, तो इवॉल्व हो रहा है. देन जीरियाट्रिक एंड रिजुविनेशन, देन पीडियाट्रिक्स, गायनिकोलॉजी एंड भूत विद्या, साइकोलॉजी, साइकोथेरेपी एंड वाजीकरण, एफ्रोडिसिक एंड फर्टिलिटी मेडिसिन. So these types of 8 limbs are there in Ayurveda medicines already described. और प्रिंसिपल्स ऑफ आयुर्वेदा, प्रिंसिपल्स ऑफ आयुर्वेदा में मैंने इन शॉर्ट में आपको हेल्थ की डेफिनेशन में बताया समदोषा समविश, जिसमें 3 दोष हैं। सबसे पहले पंच महाभूत से 3 दोषों का ओरिजिन, फिर सप्त धातु, आम, त्रिदोषा, प्रकृति। प्रकृति इज यूनिक टू आयुर्वेदा। प्रकृति इज इंडिविजुअल्स बायो कॉन्स्टिट्यूशन। इंडिविजुअल, हर इंसान की प्रकृति अलग है। जेनेटिक बिल्ट जिसे कहा जाता है, वो आयुर्वेद जो है वो हजारों साल से पहले से ही देखता है। और प्रकृति का जानकारी जो है वो उस इंडिविजुअल की, आपको मैं अभी डाइट के बारे में कुछ चीजें बताऊंगी जिससे सुन के आप हैरान रह जाएंगे। वो इंडिविजुअल प्रकृति के हिसाब से होती है। दे आर सो इंटरेस्टिंग, यू विल फील अमेजिंग। अभी यूएसपी ऑफ आयुर्वेदा जो है वो क्या है? नंबर 1 इज होलिस्टिक अप्रोच, एज आई सेड, जैसे पंचमहाभूत है, त्रिदोष है, सप्त धातु है, अग्नि है, मेटाबॉलिज्म, कोष्ठ है, स्रोतस है, ओजस है, त्रिउपस्तम माने आहार, निद्रा एंड ब्रह्मचर्य। ट्रायड्स, 3 ट्रायड्स ऑफ आयुर्वेदा आर सेड टू बी आहार सर्वप्रथम, फिर निद्रा और फिर ब्रह्मचर्य। तो सबसे पहला जो इम्पोर्टेंस है वो आहार को दिया गया है। सेकंड जो है वो निद्रा यानी रूटीन को भी दिया गया है। और थर्ड इज ब्रह्मचर्य मीन्स कैलिवेसी, वो हम बोलते हैं उसको, लेकिन इट इज कॉल्ड ऑफ पंक्चुअलिटी एंड डिसिप्लिन इन अवर होल लाइफस्टाइल। और उसके बाद में मानस, त्रिगुण, सत्व, रज, तम, उनको भी बहुत महत्व दिया गया है, क्योंकि दी होलिस्टिक ट्रीटमेंट कंबाइंस दी त्रिदोषा एंड त्रिगुणा आल्सो। और आत्मा, देन प्रकृति, एज आई टोल्ड यू, प्रकृति जो होती है वो हर इंसान की इंडिविजुअल बायो कॉन्स्टिट्यूशन होती है, और वो इंडिविजुअल के हिसाब से हम देख के और उसकी डिजीज और उसकी प्रॉब्लम को ठीक करने के लिए मेडिसिन को डिसाइड करना प्रकृति एनालिसिस के बाद ही किया जाता है। देन रसायन, रसायन इज रिजुविनेशन एंड इम्यूनोमॉड्यूलेशन, जो यूएसपी आयुर्वेदा का है। हमारी बुक जो है एक चरक संहिता होती है, सबसे मेडिसिन की बड़ी बुक है चरक संहिता, विच इज वे बैक 3000 ईयर ओल्ड रिटन। और उस चरक संहिता में कई स्थान है, 8 स्थान है, जिसपे चिकित्सा स्थान जो मेडिसिन का पार्ट है उसका फर्स्ट चैप्टर जो है वो रसायन अध्याय का हुआ है। रसायन अध्याय मीन्स रिजुविनेशन एंड जीरियाट्रिक मेडिसिन। और सबसे पहले उन्होंने जो है प्रिवेंशन को, और जो कहा गया है कि प्रिवेंशन को सबसे बड़ी जो है वो महत्व दिया गया है, और रिजुविनेशन के लिए, इम्यूनोमॉड्यूलेशन के लिए और जीरियाट्रिक्स को देखते हुए रसायन अध्याय का वर्णन सबसे पहले किया गया। उसके बाद में वाजीकरण, जिसमें कि एफ्रोडिसिएक एंड फर्टिलिटी एनहांसिंग मेडिसिन के बारे में डिजीज में सेकंड चैप्टर में बताया गया है। तो इस तरह से रसायन एंड वाजीकरण आर बीइंग एम्फसाइज्ड मोस्ट इन आयुर्वेदा। देन नाड़ी परीक्षा, नाड़ी परीक्षा में जो है वो बहुत ही यूनिक है आयुर्वेदा, वो किसी भी और मेडिसिन सिस्टम में नहीं है। नाड़ी परीक्षा जो है वो हमारे जो पुराने वैद्य थे उसकी कुछ बुक्स भी हैं नाड़ी परीक्षा की, बट यू कांट लर्न विद बाय reading those books only. You have to be a very good senior वैद्य around you, और जो कि आपको हाथ पकड़ के सिखाएं। And I am one of the very few वैद्यस जो कि मैं नाड़ी परीक्षा, मुझे ऐसे गुरु मिल गए जिनसे मैंने नाड़ी विद्या सीखी। Though I am not expert but not claim to be an expert, लेकिन हाँ मैं कुछ चीज़ों को जरूर देख सकती हूँ नाड़ी से, और हम कुछ चीज़ों को नाड़ी से बहुत अच्छे से एग्जामिन कर सकते हैं, और वो पेशेंट को स्पेसिफिक टाइम में बुला के और दोषों का एनालिसिस करके उससे हम डिजीज को जानते हैं। तो दिस इज वेरी वेरी यूनिक टू आयुर्वेदा। देन स्वर्ण प्राशन, अब यहाँ पे बहुत सारे पीडियाट्रिशियंस भी बैठे होंगे, शायद वो मुझसे वो भी करेंगे, लेकिन मैं आपको एक स्वर्ण प्राशन के बारे में एक चीज़ बताना चाहती हूँ। जैसे बच्चों को हम इम्यूनाइजेशन करते हैं, इम्यूनाइजेशन बच्चों की करते हुए जो है वो बच्चों को बहुत सारी डिजीजेस से हम प्रोटेक्ट कर देते हैं। इस तरह से आयुर्वेद में एक स्वर्ण प्राशन होता है। स्वर्ण प्राशन क्या है? स्वर्ण प्राशन में कुछ एक हर्ब्स हैं और एक जो स्वर्ण भस्म होती है उसके साथ में उसको मिक्स करके एक पर्टिकुलर डे वाले दिन, पुष्य नक्षत्र, एवरी मंथ ऑन पुष्य नक्षत्र डे, उस दिन उसी मेडिसिन को मिक्सिंग करके और उसी दिन बच्चे को एडमिनिस्टर करना होता है। और इट इज डन इन माय डिपार्टमेंट आल्सो। होली फैमिली हॉस्पिटल में हम लोग भी हर मंथ स्वर्ण प्राशन करते हैं, और वो स्वर्ण प्राशन कम से कम 100-150 बच्चे हमारे पास आते हैं स्वर्ण प्राशन के लिए, और इसकी कई स्टडीज भी हैं जो कि हम उनको वो मिक्सिंग करके उसी दिन बच्चे को पिलानी होती है वो मेडिसिन, और उससे जो है वो कई स्टडीज हैं इसकी कि कई IG लेवल और बहुत सारे इम्यूनिटी के लिए TLC और बहुत सारी चीज़ें बच्चों की देखी जाती हैं। वो कि काफ़ी मतलब जो है वो इंक्रीज पाया गया। और देर आर फ्यू सब्जेक्टिव पैरामीटर्स ऑल्सो कि कई पेरेंट्स ने हमें बताया कि हमारा बच्चा पहले स्कूल जो है वो 200 डेज जाना होता है तो वो 90 डेज जाता था, अब तो वो 180 डेज जाने लग गया या 170 डेज जाने लगा। दैट इज वन सब्जेक्टिव पैरामीटर ऑल्सो कि जिससे ये पता चलता है कि स्वर्ण जो है इट इज़ वर्किंग ऑन देयर इम्यूनिटी लेवल, और जो कि बार बार बीमार होते थे तो अब ज़्यादा बीमार नहीं है। सो इट इज़ दैट इफेक्टिव। और उसके बाद में दिनचर्या और रात्रिचर्या। दिनचर्या आप देखिए कितनी छोटी छोटी चीज़ों पे एम्फेसाइज किया गया है। आई एम नॉट टॉकिंग अबाउट एनी मेडिसिन राइट नाउ, मैं आपको लाइफस्टाइल के बारे में बता रही हूँ कि जो आयुर्वेद में कहा गया है। दिनचर्या एंड रात्रिचर्या का पूरा इलेबोरेट चैप्टर है, पूरा चैप्टर। उसमें ये बताया है कि सुबह उठना कब है, कितने बजे उठना है, और उठने के बाद में आपने क्या क्या करना है, और रात को सोने के टाइम तक का पूरा रूटीन, होल डे रूटीन हैज बीन डिस्क्राइब्ड इन आयुर्वेदिक टेक्सचर्स। आप ये देखिए कि मतलब कितना डिटेल में इन सब चीज़ों को, और उसके साथ में बाद में उसमें ऋतुचर्या का भी बताया है, किस ऋतु में क्या खाना है, किस ऋतु में कैसे कपड़े पहनने हैं, किस ऋतु में कब सोना है, दिन में कब सोना है, कौन से सीजन में सो सकते हैं, दिन में कौन से सीजन में नहीं सो सकते हैं। These small things have been taken care of। कितनी छोटी छोटी चीजें बताई गई हैं। उसके बाद में आम है, पथ्य हमारे लोग जो हर डिजीज, हमारे पास जो चिकित्सा स्थान जो मैं चरक संहिता का बोलती हूँ जिसमें डिजीजेस का डिस्क्रिप्शन है, उसमें हर 30 चैप्टर्स हैं, और अप्रॉक्सीमेटली जो है वो 170 डिजीजेस का डिस्क्रिप्शन है उसमें। और हर डिजीज की जो मेडिसिन निदान मतलब पैथोफिजियोलॉजी और इटियोलॉजी, और उसके बाद इटियोलॉजी, पैथोफिजियोलॉजी एंड देन ट्रीटमेंट, और सबसे लास्ट में एवरी चैप्टर, हर चैप्टर हर डिजीज के लास्ट में पथ्य और अपथ्य मतलब डाइटरी इनटेक एंड डाइटरी रेस्ट्रिक्शंस, दोनों चीज़ों के बारे में डिटेल में बताया गया है कि इस डिजीज के पेशेंट को ये डाइट खानी है, ये खाना लेना है, और ये नहीं खा सकते। सो दिस काइंड ऑफ इन डेप्थ फॉर डाइट। इसीलिए मैं जनरली लोगों को, यहाँ पे कोई डाइटिशियन भी होगी लेकिन आई डोंट डिसएग्री विद देम, बट आई प्राउडली से कि जो आयुर्वेद वाला डॉक्टर, आयुर्वेद का जो वैद्य आपको आपकी प्रकृति और आपके डिजीज के हिसाब से डाइट का बता सकता है, वो शायद ही कोई और बता सके। न्यूट्रिशनल जो न्यूट्रिशनिस्ट हैं वो कैलोरीज को देख के और आपके लिए क्या प्रोटीन चाहिए। अब सिंपल सी चीज़ में आपको एक एग्जांपल देना चाहती हूँ कि जो प्रोटीन है, प्रोटीन आप कहते हैं कि इतने ग्राम प्रोटीन हमारी बॉडी में चाहिए, लेकिन क्या आपको ये पता है कि जो प्रोटीन आप ले रहे हैं वो आपकी बॉडी में पूरा एब्जॉर्ब हो रहा है या नहीं हो रहा, आपको वो मिल रहा है या नहीं मिल रहा, आपकी बॉडी में मसल मास बढ़ रहा है या नहीं बढ़ रहा, स्ट्रेंथ आ रही है या नहीं आ रही। ये चीज़ जो है वो प्रकृति के साथ में जानी जाती है, और प्रोटीन के आपकी बॉडी के हिसाब से क्या प्रोटीन आपको लेना है वो हम बताते हैं। लोग बहुत प्राउडली बोलते हैं डॉक्टर साहब सोयाबीन तो बहुत कॉमनली सब लोग खाते हैं, बट सोयाबीन का तो बहुत सारे लोगों में एब्जॉर्प्शन ही नहीं होता, इट डजंट गेट एब्जॉर्ब इन बॉडी। सो इस तरीके से जो चीज़ें हैं वो छोटी छोटी चीज़ों को हम आपको बताते हैं, और उससे जो है हम आपको हेल्प करते हैं। और उसके अलावा आप विरुद्धाहार इज अ वेरी वेरी इंपॉर्टेंट थिंग जो कि बहुत सारे कॉमन लोगों को पता ही नहीं है। विरुद्धाहार मतलब लोग जो हैं मैंगो शेक पीते हैं, बनाना शेक पीते हैं, विच इज़ ए कॉमन वेरी वेरी कॉमन ड्रिंक इन एवरी हाउस होल्ड। अब मैं आपको बताऊं कि दूध के साथ में अगर हम फ्रूट्स को मिक्स कर देते हैं तो मिल्क इज मधुर रस एंड फ्रूट्स आर अम्लपाकी। वो चाहे कितना भी मीठा हो लेकिन हमारे गट में जाके वो अम्लपाकी हो जाता है, एसिडिक हो जाता है, और वो उसको दोनों को हम मिला देते हैं और उसका शेक बनाते हैं तो वो हमारे गट को वीक करता है, गट को खराब कर देता है, हमारी एब्जॉर्प्शन को खराब करता है। सो दीज आर वेरी स्मॉल थिंग्स। इसके अलावा मैं तो पेशेंट्स को ये एग्जांपल देती हूँ, क्या आप दूध में कभी लेमन डाल के पीते हो, क्या आप कभी दूध में नमक डाल के लेते हो, इसी तरह से दूध के साथ में फ्रूट्स नहीं लेना है। सो दीज आर द कॉमन थिंग्स वी जनरली टेल पेशेंट्स, वी जनरली टीच अवर पेशेंट्स। इसके साथ में आचार रसायन के में जो है वो तो बहुत ही कॉमन है, सबको सिखाया जाना चाहिए। जैसे रोज बोलते हैं, सब दुनिया सिखाती है कि बच्चों को रोज सिखाइए कि उसको ग्रीट करना है, उसको नमस्ते बोलना है, उसको पाँव छूने हैं। इस तरह से आयुर्वेद भी पूरा आचार रसायन जो है कि सत्यवदम, सच बोलना है, धोखा नहीं करना है। बहुत सारी ऐसी कॉमन चीज़ें हैं जो कि हेल्थ के लिए भी हैं और जो कि जनरल रूटीन और जनरल एक ह्यूमन बीइंग को डेवलप करने के लिए, एक संस्कार डेवलपमेंट करने के लिए, वो भी पूरा आयुर्वेद में बताया गया है। और उसके अलावा सबसे इम्पॉर्टेंट है, इंटेग्रल पार्ट ऑफ आयुर्वेदा इज कॉल्ड पंचकर्मा। पंचकर्म जो है वो उसको आयुर्वेद की आधी चिकित्सा कहा जाता है। सो पंचकर्म क्या है बेसिकली? पंचकर्म इज कॉल्ड बेसिकली, जिसको हम इंग्लिश में अगर ट्रांसलेशन करें तो वी कैन से बायो प्यूरिफिकेशन। अब व्हाट इज बायो प्यूरिफिकेशन? व्हाई बायो प्यूरिफिकेशन? क्यों करें? पंचकर्म क्या, हमारे पास लोग आते हैं बोलते हैं पंचकर्म क्या हेल्दी लोग करवा सकते हैं? हमारे यहाँ सबसे पहले जो डिस्क्रिप्शन किया गया है वो यही कहा गया कि हेल्दी को ही करवाइए, ताकि उसको कोई डिजीज ना हो, उसको कोई बीमारी ना हो, उसकी हेल्थ बनी रहे। आप हेल्दी लोगों को पंचकर्म करवाइए। और ये जरूरी नहीं है कि कंप्लीट पंचकर्मा करिए, आपकी प्रकृति के हिसाब से जो रिक्वायरमेंट है वो पंचकर्म करिए। पंचकर्म में बेसिकली 5 कर्म होते हैं, जैसे वमन, विरेचन, आस्थापन बस्ती, निरू बस्ती और शिरो विरेचन, लस्य कर्मा, ये कहा जाता है। अब जो सिंपल सी चीज़ है कि अभी डॉक्टर जो हमारे डॉक्टर आई के डॉक्टर ऑप्थेल्मोलॉजिस्ट जो डॉक्टर साहब ने अभी लेक्चर दिया, तो उन्होंने एक विडालक का एग्जाम्पल दिया। फिर मैंने उनको एक वीडियो भी दिखाया जो हमारे यहाँ नेत्र तर्पण होता है। उन्होंने विडालक कहा था, हमारे यहाँ नेत्र तर्पण एक थेरेपी होती है। तो आई टोल्ड हिम कि हमारे यहाँ पे एक बहुत ओल्ड 87 ईयर ओल्ड लेडी आती थी, जिनको ARMD भी था और ग्लोकोमा भी था और कैटरेड का उन्होंने ऑपरेशन ही नहीं करवाया हुआ था, और उनको उसके साथ में जो है पोस्ट हर्पेटिक न्यूरैल्जिया भी था, तो जिसकी वजह से उनको हमेशा हेडेक और आई में पेन रहता था। तो हम लोग उनका एवरी 6 मंथ्स जो है वो नेत्र तर्पण करते थे। शी इज नाउ नो मोर। तो उनका हम जो है एवरी 6 मंथ्स जो है वो नेत्र तर्पण करते थे, जिससे कि उनको इतना अच्छा रहता था कि वो अपने आप हर 5वें महीने मुझे कॉल कर देती थी कि डॉक्टर रितु मेरा ड्यू हो गया, आप प्लीज़ मेरा करिए, दोबारा से स्टार्ट करिए। तो एवरी 6 मंथ्स वो करती नहीं, वो कोई मेडिसिन नहीं खाती थी आई की। मेरी एक आधी टैबलेट होती है आई की, हमारे पास कुछ एक मेडिसिन होती है आई की जो मैं सिंपल मेडिसिन दे देती थी उनको, एंड शी यूज टू गेट कम्प्लीटली ऑलराइट। उनको हेडेक भी नहीं होता था, उनको नींद भी ठीक से आती थी, सब कुछ होता था। बट यहाँ ये है कि लाइफ में स्ट्रेसेस तो हर एक के हैं। हर सिस्टर पास कर रहे हैं, हर डॉटर गॉट कैंसर, तो उससे ऊपर नीचे तो सबकी चीज़ें होती हैं, लेकिन अल्टीमेटली शी यूज टू गेट रिलीफ फ्रॉम ऑल दीज सिम्टम्स। सो अभी मैं थोड़ा सा रसायन चिकित्सा के बारे में जैसे बताती हूँ कि रसायन चिकित्सा जो है वो USP है आयुर्वेद का। तो रसायन चिकित्सा में जो है वो बेसिकली इट इज रिजुविनेशन एंड इट इज मेंट फॉर जेरियाट्रिक पेशेंट्स। कि हमारे यहाँ बेसिकली ये रसायने तु मध्य वयसी, ये कहा गया है कि जो रसायन चिकित्सा है, जो रिजुविनेटिंग आयुर्वेदिक मेडिसिन हैं। आजकल तो ओवर द काउंटर कितनी सारी दवाइयाँ अवेलेबल है, लोग अश्वगंधा मार्केट से जाके खरीद लेते हैं, डॉक्टर साहब हम तो अश्वगंधा खा रहे हैं, हम तो जो है हल्दी के कैप्सूल खा रहे हैं, हम तो दूध में हल्दी मिला के पी लेते हैं, हम आंवला ले लेते हैं, हम च्यवनप्राश ले लेते हैं। लेकिन ये भी लोगों को मेरी राय ये है कि डॉक्टर से पूछ के ही लेना चाहिए कि उनके लिए कौन सा रसायन जो है वो अच्छा है, और उसको अगर प्रॉपरली रसायन का सेवन करेंगे। बहुत सारे ऐसे लोग हैं जिन्हें अश्वगंधा सूट ही नहीं करता, वो ले रहे होते हैं, उनका गट खराब हो जाता है, उनको बहुत सारी प्रॉब्लम्स आने लग जाती हैं। तो हम उन लोगों को समझाते हैं। बहुत सारे लोग कहते हैं कि दूध में हल्दी मिला के पी लेते हैं। बहुत सारे ऐसे लोग हैं जिनको मिल्क ही सूट नहीं कर रहा होता, जिनको दूध में हल्दी सूट ही नहीं करती है, तो दे कांट टेक। तो इस तरह से अगर आप डॉक्टर की उससे परमिशन से, डॉक्टर की प्रिस्क्रिप्शन से अगर आप कोई भी रसायन, कोई भी रिजुविनेटिंग मेडिसिन, जेनेटिक मेडिसिन अगर लेते हैं तो उसमें हेल्थ जो है वो बहुत बहुत अच्छी रहती है। सो निदान परिवर्जन इज द फर्स्ट एम ऑफ आयुर्वेदा, जिसमें मैंने सबसे पहले बताया था स्वास्थ्य से स्वास्थ्य दर्शन। तो इसमें ये एक और श्लोक लिखा है आयुर्वेद में, सर्वमन्यम परित्यज्य शरीरम अनुपाले तद्भावे ही भावनाम सर्व भावनाम शरीरम। मतलब सारी चीजें छोड़ के हमें सबसे पहले अपनी बॉडी को, अपनी हेल्थ को देखना चाहिए, क्योंकि उसी का ठीक रहने से सब कुछ ठीक है। आप एक छोटी सी चीज का एग्जाम्पल मैं आपको देती हूँ कि छोटा सा हेडेक जो है किसी को अगर हो गया तो वो इस सेमिनार में मेरी टॉक सुनने और किसी की भी टॉक सुनने आ नहीं पाएगा। वो पेन किलर पॉपअप करेगा तभी आ सकेगा, जब वो ठीक होगा तभी वो सुन सकेगा। तो छोटा सा बीमारी जो है वो आपको इतना बीमार बना देती है कि आप कुछ भी काम करने के काबिल नहीं रहते हैं। इसलिए सबसे पहले जो है वो निदान को परिवर्जन करना है। जो हमें बीमारी दे रही है चीज़, उसको हमें छोड़ देना है उसको छोड़ने से ही हम हेल्थ की तरफ जा सकते हैं। अब पंचकर्मा का जो मैंने बताया है कि हाउ पंचकर्मा इज वेरी वेरी इंपॉर्टेंट। पंचकर्म जो है वो करने से बहुत सारी बीमारियां जो हैं वो हम उनको फॉरगो कर सकते हैं, उनको ठीक कर सकते हैं। अब मैं फॉर एग्जांपल आपको कुछ बताऊं तो जैसे सोराइसिस के पेशेंट हमारे पास आते हैं तो विद इन 1 वीक ऑफ अवर पंचकर्मा थेरेपी, नॉट अ मेजर, विद इन 1 वीक पूरी बॉडी में अगर फैले हुए स्केल्स है ना, मैं कंप्लीट क्योर की नहीं बात कर रही हूँ, लेकिन जो पेशेंट की इमीडिएट कंसर्न्स हैं वो 1 वीक ऑफ थेरेपी में उसका पूरा क्लियर हो जाता है। इतना इफेक्टिव हमारा पंचकर्मा थेरेपी होती है। अगर रूमेटॉइड आर्थराइटिस के, ऑटो इम्यून डिजीज के पेशेंट्स हैं तो उसमें अगर हम पंचकर्म करते हैं, पेशेंट अगर एलोपैथिक मेडिसिन ले भी रहा है तो उसके साथ में ही अगर हमारा पंचकर्म करता है तो उनकी जो पेन्स हैं, उनकी स्टिफनेस है, उनकी जो पीड़ा है वो दूर हो जाती है। दैट्स हाउ वी डू इट। So these are the 5 procedures, Panchkarma procedure, Vaman, Virechan, Anuvasan, Vastiya, Saman, Vastiya, Nasya Karma, which I told you. ये different seasons में किए जाते हैं, different diseases में किए जाते हैं और different conditions में, patient conditions में, different individuals में अलग-अलग conditions में किए जाते हैं, जो कि बहुत ज़्यादा intricate है, which I will not throw any because it is a very deep and detailed issue. Dr. Vipul थोड़ा short कर सकते हैं? Yes ma'am, sure. So areas of concern of integration, कहाँ पे हम integrate कर सकते हैं? I'll take 2 more minutes now. So like chronic autoimmune diseases like rheumatoid arthritis, ankylosing spondylosis, psoriasis, lupus, SLE, then GI related problems like chronic gastritis, MASLD, IBS, colitis, Crohn's disease, piles and fistula, and then all types of cancer. बहुत सारे कैंसर पेशेंट्स हमारे पास आते हैं जो कि एलोपैथिक में मेडिसिन लेते हुए भी, कीमोथेरेपी, रेडियोथेरेपी करते हुए भी हमारी मेडिसिन साथ में लेते हैं। एंड फॉर योर काइंड इन्फॉर्मेशन टू दिस फोरम कि हम लोगों ने एक एम्स में डॉक्टर अनुराग श्रीवास्तव जो है वो HOD सर्जरी थे, उनके साथ में मैंने एक प्रोजेक्ट भी किया था लॉन्ग बैक व्हेन आई फिनिश्ड माय MD कि टू कॉम्बैट द साइड इफेक्ट ऑफ कीमोथेरेपी एंड रेडियोथेरेपी विद सम आयुर्वेदा प्रोडक्ट और उसके हमें बहुत अच्छे रिजल्ट्स मिले थे। और इसी के साथ ही एक और पायलट स्टडी करी थी जिसमें कि नॉन हीलिंग अल्सर जो कि किसी भी एलोपैथिक टॉपिकल मेडिसिन से नहीं ठीक होते थे, तो हमने एक सिंपल मेडिकेटेड ऑयल है आयुर्वेदा का, जात्यादी ऑयल, उसको हमने वहाँ पे स्टडी करवाया था उनकी ड्रेसिंग रूम में, जो कि आज भी वहाँ पे यूज होता है नॉन हीलिंग अल्सर्स की ड्रेसिंग के लिए। सो दीज थिंग्स यू नो वी हैव डन वेरी साइंटिफिकली। और कैंसर के पेशेंट्स का तो हमने किया ही है, आज ही मेरे पास आते हैं। और इसके अलावा जितनी भी एलर्जिक प्रॉब्लम्स हैं, माइग्रेन एंड अदर क्रॉनिक हेडेक्स, इंसोम्निया, एंजाइटी, न्यूरोसिस, OCD और अदर साइकेट्रिक प्रॉब्लम्स, फिर ऑस्टियोआर्थराइटिस, सर्वाइकल स्पॉन्डिलोसिस, ये तो पंचकर्म से बहुत ही जल्दी ठीक हो जाते हैं और बहुत अच्छे ठीक हो जाते हैं। लंबर स्पॉन्डिलोसिस, PIVD, शियाटिका, फ्रोजन शोल्डर की लॉन्गेस्ट ड्यूरेशन जो है वो पेशेंट का ठीक ही नहीं होता। लोग महीने 2 महीने फिजियोथेरेपी, मेडिसिन, पेन किलर लेते रहते हैं, लेकिन हमारे पास आते हैं, हम थोड़ा सा पंचकर्म करते हैं, कुछ दिनों के लिए करते हैं और विद इन फ्यू मंथ्स हम उसको कंप्लीटली क्योर कर देते हैं। कार्पल टनल सिंड्रोम, प्लांटर फेशियाइटिस, ये सब चीज़ों को हम ठीक करते हैं। मेल एंड फीमेल इनफर्टिलिटी, आई से प्राउडली कि हम विदाउट एनी हार्मोन, कोई भी हार्मोन को दिए बिना हम लोग PCOD, PCOS और कोई भी हार्मोनल थेरेपी, पेरीमेनोपॉजल, पोस्ट मेनोपॉजल, इन सब चीज़ों को ठीक करते हैं जो कि इमोशनल इश्यूज फीमेल्स के साथ हो जाते हैं और कई भी फिजिकली भी इश्यूज हो जाते हैं, उन सब चीज़ों को भी ठीक करते हैं। देन अनकंट्रोल्ड डायबिटीज़ है, हाइपरटेंशन है, इसमें पेशेंट एलोपैथिक मेडिसिन लेने के साथ में हम थोड़ी सपोर्टिव मेडिसिन देते हैं जिससे काफ़ी कंट्रोल हो जाता है। एंड मैनी मोर। थैंक यू सो मच। देयर इज टाइम लैग, तो वाई इंटीग्रेशन, जस्ट वन मोर थिंग, सेफ एंड एफिकेशियस है, कॉस्ट इफेक्टिव है और लोअर द फाइनेंशियल बर्डन ऑफ ग्लोबल हेल्थ केयर है, टू एप्रोप्रिएट सॉल्यूशन फॉर पेशेंट्स है, टू लोअर बर्डन ऑन एलोपैथिक डॉक्टर्स एंड हॉस्पिटल्स ऑल्सो। Thank you so much. But I know that you have helped many people across the world, and I know that. Thank you so much.
The Saraswati Vandana you recited energized all of us and enhanced our mental focus, and the emphasis on Ashtanga Ayurveda was absolutely noteworthy. It is indeed my proud privilege to call Dr. Chitra Sethia on the dais, where she will be speaking about lifestyle medicine, addressing the root cause of the disease. Dr. Chitra is a lifestyle disease management consultant with over more than 41 years of clinical experience. Dr. Chitra serves as the senior consultant and head of the department for obstetrics and gynecology at Apollo Hospital, Noida.
I have been awarded the last talk. Let me just hope I can hold your attention.
I hope she doesn't blame her husband.
I do. Okay, so lifestyle medicine, we are coming back to allopathic medicine. It's a form or an adjunct of allopathic medicine itself with evidence-based treatment of lifestyle medicine. It is addressing the root cause of disease. Now, what is lifestyle medicine? It is looking at a person as a whole and not just as a body exhibiting symptoms of a particular disease. It is the application of exercise, diet, stress reduction, sleep, and social relationships in a clinical setting to treat and reverse certain lifestyle-related diseases. It is the need of the current hour, and you can see every day the papers are talking about lifestyle. Today, the Hindustan Times had a huge middle page cover of lifestyle medicine. So also the Indian Express had a lot of talk on diet and fiber. This is this is the need of the current hour with our mostly dysfunctional lifestyles giving rise to many chronic diseases. This is a multidisciplinary, evidence-based modality with a lifestyle medicine physician, a nutritionist, a physical instructor, and a counselor to address all aspects as and when required. It also addresses the fact, this is very, very important, that practitioners have to be fit themselves to promote this branch, because what you are advocating, you have to be doing it. Now, 80% of chronic diseases, this has been already talked about. What are the chronic diseases which are due to lifestyle dysfunctions? And causes are mental stress, sleep deprivation, sedentary lifestyle, excessive calorie intake and an unhealthy diet, leading to abdominal obesity, dyslipidemia, hypertension, diabetes, fatty liver disease, and cardiac diseases. Now, what are the 6 pillars of lifestyle medicine? These are nutrition, physical activity, restorative sleep, stress management, social connection, and avoiding alcohol, tobacco, and other drugs. The current scenario of nutrition in India is that the kitchens are being closed, and that is the tragedy. The youngsters are hardly ever cooking at home. They're ordering from Swiggy, from Zomato. There is no fresh food being cooked every day. And the key principles of nutrition is a whole food, plant predominant diet, which is importantly composed of whole, minimally processed plant foods like fruits, vegetables, whole grains, legumes, nuts, and seeds. Why I have specifically shown you this picture of the grain anatomy is that the lovely basmati white rice what we are having, in a grain there is the germ, the bran, and the endosperm. When we are refining our rice, we are destroying the germ and the bran, which are the important aspects of rice. So we have this nice polished rice, but we have only carbs in it, not the nutrients and not the fiber. So minimize processed foods, limit foods high in sugars, excess salt, saturated fats, and trans fat. Plant foods are rich in fiber, which is crucial for gut health and overall longevity. Prioritize foods that provide vitamins, minerals, and other micronutrients over high-calorie, low-nutrient foods. Even small changes to dietary habits can lead to substantial health benefits. If you look at the processed foods in India, there are plenty. If you enumerate all of them, there's dairy, there's fruits and vegetables, grains, meat and poultry, snacks, which people are really having every time they watch TV, in between meals, everything. Beverages, and the worst is the ready-to-eat and the ready-to-cook meals, frozen foods and instant mixes. So eat plenty of the left side chart which you have and limit and avoid the right side ones. So the ideal platter should be, half the platter should be your salads, fruits and vegetables. 1/4 of the platter should be of proteins, which are basically plant proteins. You know, everyone has this concept that animal proteins are higher in fat, are higher in protein, which is not true. Plant proteins are rich in proteins and the advantage of fiber, whereas animal proteins have protein and fat. And 1/4 of your platter should be with your whole grains. And you get enough of whole grains now. You get brown rice, you have kapli atta, which has bran enough in it. The second aspect is exercise, which is a subcategory of physical activity that is planned, structured, repetitive and purposeful, so that by improving or maintaining physical fitness, the object of health is attained. Now there are four components of exercise: aerobics, strength training, flexibility and balance. And each of them plays a role in your physical fitness. Aerobics leads to cardiovascular endurance, is the ability of the heart, lungs and circulatory system to deliver oxygen and nutrients to the body during prolonged physical activity. Often seen as the foundation of overall fitness, crucial for supporting sustained exercise and everyday activities. Running, brisk walking, dancing, swimming, all these come under aerobics. Gradually increase the intensity and duration of workouts. Muscular strength, again, very, very important, which a lot of us don't focus on. Strong muscles support overall body mechanics, improve bone density and reduce the risk of injuries. Focus on weightlifting exercises like bench presses, deadlift or squats. Even your yoga, you are weightlifting your own body, so there is a lot of resistance training in yoga. Use resistance bands for progressive muscle overload. Opt for body weight exercises like push-ups, which can also boost strength over time. Helps prevent muscular wasting or sarcopenia, which develops in old age. Flexibility. Here I've taken the, I put my own photograph, which is my current photograph. So flexibility is not related to age, it is related to how often you do it. It's the ability of the joints and muscles to move through their full range of motion. Flexible muscles and joints reduce stiffness, improve posture and enhance overall mobility. It also minimizes the risk of muscle strains and helps the body recover faster after exercise. Explore yoga or Pilates to boost flexibility and improve joint health. Now balance. This a lot of people don't practice, and it's a very, very important part. This is balance and proprioception. Balance is vital for injury prevention and maintaining functional independence, especially in older adults. It's very, very important for fall prevention. That is what happens as you grow older. You slip on a staircase, you slip on while walking, and that leads to fractures. So it is important for preventing that, better postural control, better neuromuscular health. Because this controls the proprioception, the relation between the mind and the body. Improves alignment and stability, decreasing musculoskeletal strain and discomfort. Strengthens the brain-body connection, optimizing motor learning and coordination. How to incorporate fitness components into your routine? It's very simple. Include 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week, which is not asking for too much. It's 30 minutes of walk, 3 days a week. That is enough. Muscular endurance and strength. Perform resistance training exercises targeting the major muscle groups at least twice a week. Flexibility and balance. Stretch daily or after workout to maintain joint mobility. And practice balance to prevent falls. So the CDC recommendations are for adults, it should be 2.5 hours of moderate or vigorous activity per week. And for children and adolescents, it should be 1 hour per day. And most of our children don't do this. We as parents and grandparents have to ensure this. Now coming to sleep. This is again a very, very major issue which is happening nowadays. It is sleep disorders are a group of conditions that disturbs normal sleep patterns, and this is one of the most common clinical problems encountered. A lot of neurologists will be facing this. A lot of physicians will have patients coming to them that we're not sleeping enough. Inadequate or non-restorative sleep can interfere with normal physical, mental, social, and emotional functioning. Sleep disorders can affect overall health, safety, and quality of life. All of you know about the circadian rhythm of the body, which is responsible for the biological clock of the body. If you look at it, the melatonin secretion starts around 9 o'clock, and melatonin is your sleep hormone. So that is when the secretion of melatonin starts, and that's when you start feeling sleepy. And this finishes by about 4:35. So our older generation, in India, it was that sleep before sunset and get up after sunrise. So that should be the pattern followed, because your body needs rest and the body hormones go into a sleep pattern at night. This was a very recent article in Times of India that Indian teens are struggling with this morning sickness because of lack of sleep. And they've done an extensive study in 2 metros, Gurugram and Bangalore, and they found that 84% use the phones before bedtime, 60% are sleepy during work hours, and 38% persons feel that less screen time will improve sleep. And as high as 84 to 90% are phone users before sleep. Now, sleep plays an important role in almost every system of the body, and a disorder can lead to mental health disorders, immunodeficiency, cardiovascular, hormone balances, diabetes, obesity, and pain in the joints. Now, sleep crisis, the problems are average sleep has dropped from 9 hours to 6.8 hours. 30% of adults sleep less than 6 hours at night. Causes are generally work stress, social demand, shift work, and jet lag. And the common sleep disorders are insomnia, sleep apnea, circadian rhythm disorders, hypersomnias, and parasomnias. So sleep deprivation, common symptoms are daytime sleepiness, fatigue, irritability, trouble in thinking, headaches, slowed reaction time, and causes, we all know these causes. So how much sleep is enough? For infants, it is 15 to 17 hours. For teenagers, it is 8 to 10 hours. And for adults, it is 7 to 9 hours. Now, treatment, non-pharmacological, are cognitive behavioral therapy for insomnia. Sleep restriction therapy limits the total time allowed in bed to increase the drive to sleep. Stimulus-controlled therapy helps change sleep habits so that the patients don't have difficulty in falling asleep. Patients should also not go to bed until they are sleepy. Also, the bed should be used only for sleeping and sex, and not for watching television or reading books. Relaxation therapy. Relaxation techniques may be implemented as pranayam, sitting in Vajrasan. Brahmari pranayam is said to help in sleep. Then, of course, the other methods like chamomile tea, tulsi tea, haldi ka doodh, and a hot shower before bathing. All this helps. Pharmacological, I'm not going to go into because none of us can prescribe it. The only thing which can be used is melatonin. Then coming to stress reduction. Stress, I think everybody, if you look at children who are coming to your hospital, to your clinic, they all say they are stressed. Right from class 8 onwards, one exam and they are stressed. So we have to decrease the stress during the day. Physical and lifestyle changes, exercise regularly, eat a balanced diet, prioritize sleep, limit caffeine and alcohol, and get outdoors. People are sitting inside the rooms, not getting out at all, and you should get some outside air. Relaxation and mental techniques, practice mindfulness, meditate, deep breathing exercises, journaling. A lot of people are worried about what all they have to do tomorrow. They're thinking about that, so they don't go to sleep. So they say, just write down what all you have to do tomorrow. That is off your mind, then you'll get some sleep. Now, 2 major things which are very, very prevalent today is tobacco. It is a leading cause of preventable death and disease, and most related to cancer, cardiovascular, and COPD. Life expectancy is at least 10 years shorter for smokers as compared to non-smokers. Timeline for the benefits of quitting. Immediate quitting cuts the risk of sudden death from a heart attack by 50% compared to someone who continues to smoke. Within 1 year, the risk of heart disease is 50% that of a non-smoker. 2 to 5 years, the risk of stroke is approximately equal to that of a non-smoker, and in 10 years, the risk of lung cancer is reduced by 50%. Alcohol. The current CDC guidelines say not to exceed for men 2 drinks per day, and for women and those aged 65 and older 1 drink per day. Now what is binge drinking? 5 drinks in 2 hours for men or 4 drinks in 2 hours for women. Heavy alcohol use is binge drinking on more than 5 days a month. And at-risk drinking is that exceeds the level above for any day of the week, binge drinking at least once a month. And health effects, you have multiple health effects of alcohol. So aim for a healthy lifestyle, consume an overall healthy diet, aim for a healthy body weight, aim for recommended levels of LDL and HDL, aim for a normal blood pressure, blood glucose, be physically active, and avoid the use and exposure to alcohol and tobacco products. So let us hope that in all stages of life, we have a healthy existence. Thank you. Colorful slides are to my granddaughter who's 11 years old, who told me, Nani, you should have slides which are nice and colorful, like all the colors of the rainbow should be there. So I tried to incorporate that. Thank you.
Thank you, ma'am, for sharing the insights, the beneficial scientific tips for promoting longevity. The floor is now open for question and answer session. As we are running short of time, I'd request everyone to be a little quick.
2 minutes of questions. I'll just hand the mic to my co-chairperson. But before that, thank you very much, everybody. The talks were excellent. Dr. Ritu, sorry for cutting you short. But I know in person you have treated a lot of people with Ayurveda. Arvind, you were just brilliant as usual. It was interesting to hear that garlics and onions and things don't have to be stopped when you take homeopathy. Chitra, you're my old classmate and you were just fantastic. And I think with naturopathy and all the other systems of medicine, we are definitely going to make a difference. And it is for us sitting here who have to decide to make a difference by moving together in the right direction. There are some questions.
Thank you very much, first of all, Dr. Setia, my revered friend, for each one of these fascinating discussions on different schools of medicine. Just one thing which seems to have gone unnoticed and will have to be mentioned is, we are here for the Venu Institute of Integrative Medicine and Research. And I would underline the integrative part of it. We have been listening with rapt attention to the skills, to the proficiencies possible in each one of the schools of medicine. Undoubtedly, each one of the speakers was stalwarts in their own line, and I find myself extremely enlightened on the subject. But what you have been witnessing in the last 2-3 years, with the aggressive kind of quality of social interaction, social discourse which is happening it is precisely the lack of integrity, or integration rather, which has come to characterize the medical fraternity. I hope you all will remember in the last 2 or 3 years how ugly and how nasty the altercation between the different schools and systems of medicine has been, which went all the way up to the Supreme Court, and also caused embarrassment and a lot of disconcertation to highest possible dignitaries and representatives of the 2 or 3 schools of medicine. One person of Ayurveda saying all kinds of things, whether by way of advertisement, etc., for the other one, called up for contempt. The other one equally, what an irony, the other one equally found guilty of a similar kind of breach hauled up for contempt all over. Now, I was on the point that this is an institute, not perhaps for propagating the proficiencies or the capabilities of each one of these schools of medicine, which we have just now been party to. I would rather think that at least one little part or portion of this, 10% or 20% of the energies of this institute, by way of constituting a cell or a committee to constantly keep a monitoring on whether there is some kind of, I thought the idea was to bring about more bonhomie, friendship, harmony, integration between these 2 or 3 or 4 or 5 different medical schools, schools of medicine. But we perhaps would be better off if, while you are laying down your agenda for the future, there is a cell, because prevention is better than cure. We've learned from you only. So prevent disharmony before it comes to some court or kachehari, disciplining the different schools of medicine and thereby wanting to cure it. That would not be the right thing. Be the conscious keeper, be also the watchdog that these lines are not crossed by these schools of medicine. That, I think, would be a good idea for the Venu Institute to undertake. Thank you so much. I thought it was very unnoticed that this would be, and why call a lawyer at all? Rightly so. Why call a lawyer at all in the midst of a noble profession like doctors? Thank you for being permitted.
मैं एक चीज़ की तरफ पॉइंट आउट करना चाहती हूँ। यहाँ पे बहुत तरह के डॉक्टर्स हमें मिले, स्किन के, आयुर्वेदिक, होम्योपैथिक एक्सेट्रा। एक डॉक्टर भूल गए, और सबसे बड़ा डॉक्टर चित्रा बता रही थी कि बच्चों के में स्ट्रेस है एक्सेट्रा। तो जो सबसे बड़ा डॉक्टर है वो तो यहाँ इंक्लूडेड ही नहीं है, वो है माँ। मैं आपको बताती हूँ कि मेरी बच्ची थी, वो एग्जाम्स के पहले उसको हमेशा बुखार आता था, और बुखार भी की सच्ची मुस्का थर्मामीटर में आने वाला। तो मैंने एक रोज उससे कहा कि अनीशा बेटा, अब तुझे एग्जाम के पहले बुखार आया ना तो तेरा पलंग बाहर लगवा दूंगी, बस वहीं तो सोना, हम सब जाएंगे। उसके बाद वो दिन, और जब तक वो पढ़ी जब तक उसको बुखार नहीं आया।
Hello everybody, I am a pediatrician. So I thought to give you one small tip. Please remember a digit called 85210. 8 stands for 8 hours of sleep, Dr. Chitra just mentioned. 5 means 5 colors of fruits and vegetables every day for everybody. 2 stands for 2 hours of non-recreational screen time, that too in 2-3 installments. 1 hour of actually good exercise, the kind of exercise of Chitra mentioned. 0 is 0 caffeinated and sweetened drink. So if you have all the steps, 85210, it's one for all. Lastly, please increase the green time, not the screen time. What you mentioned about these are all part of green time. You're going for exercise, reading books, sleeping well. These are all green times. That's what I mean. Thank you.
I have a question for Dr. Deepak. He's from the naturopathy department of Venu and a part of the integrated medicine, so I'm sticking to the topic. Looking at the audience, I think my question will be common to many. Is there a diet for cholesterol?
Yes, ma'am.
I'm sure many of us will be having either for us or our family members. Deepak.
Yeah, so in naturopathy, basically we are treating cholesterol and heart disease with a diet, yoga, and some hydrotherapies. The main portion is about the cholesterol. In cholesterol condition, we are providing a medication diet in the test diet. In the test diet, basically we are providing a low sodium, low carbohydrate diet basically. And we talking about the therapies, we are providing the wet sheet pack. So what's the wet sheet pack? Now wet sheet pack, we are wrapping the people with the cold water. And after that, we are providing the woolen sheet, which increase the thermoregulation of the body. And we talking about some herbs as well as single herbs. We are giving Arjun chal water, coriander seed water. In coriander seed water, some enzymes is there, but name is the linolene and the bernoulli. These are the help in the reducing the cholesterol from the body and help in the bile synthesis. We all know bile is the element which help reduction in the body with in the help of the stool. So these are the approach for the reducing the cholesterol from the body.
No, this is not about any medicine. It is about your lifestyle changes. Increase your whole grains, incorporate millets in your diet, introduce exercise regularly, have sleep properly, and decrease your saturated fats. Just that, and your exercise and sleep will rectify your cholesterol. Definitely.
I have a question here. I am not a doctor, I am rather most of the time a patient. So my question would be, we are talking about integrated medicine, and when I go to a hospital, and my friend here would like to ask this question, so I'm on his behalf asking this question, maybe because he's very young and shy. So the question is, if I enter a hospital, I need a person who will guide me probably which path of medicine shall I take. Shall I take the Ayurveda, homeopathy, allopathy, or any other form that is prevalent like healthcare? So far most of the hospitals, as I understand, don't have a center or a person who is a counselor, a medical counselor, to send you a certain direction. Most of the time, you are under the hands of a specialized person. Now, today's agenda about integrative medicine should provide such a position within a hospital. It's a very basic question from a person.
Sir, have you directed this question to somebody specific?
No, I think that is what we are missing.
Okay. So
this should be maybe to Dr.
Ashwin.
Ashwin.
I'll just give it to Dr. Ashwin, because I think he started off by saying that there would be a board with a medical counselor who will decide which form you would fit for you, not one form fits all, and then give you an integrated.
No. So, see, it is the evaluation. First step when the patient comes in, he is treated by the counselor. The counselor evaluates, takes the history, does the examination, and makes a differential diagnosis of what is the possibility. And then evaluates the basic test if need be. And after that, the patient sees a board. There will be all the specialists available, and he will be given an informed choice that this may be the best thing for you, but you got to choose it.
Could I add to that question?
Sure.
Can this be addressed to somebody online? Do you have to come to a place like Venu? You could speak, have a Zoom session or something like that?
Right. So, see, telemedicine can be utilized. However, let me tell you that a part of medical evaluation, physical examination is a very, very big part. You cannot make a diagnosis of any sickness without examination. As far as modern medicine is concerned, Arvind may differ. That's what I asked Arvind, he's a homeopath.
So Ashwini, what kind of a questionnaire or what kind of qualification would this counselor have? I mean, how would this counselor decide? Sorry? How would this counselor decide? What qualification does this counselor have to take a decision as to what would be
No, the counselor is not deciding. Counselor is not deciding. Counselor is just the first point of contact to see what the patient is suffering from, or to know what the patient is having. The counselor is taking the history and evaluates and then puts in before the board what it is.
In the meantime, we will keep on suffering.
Sorry? No. So see, there is no time lag. We are going to make, it is a complete flow. I wonder whether you, one of the slides which I presented was a patient flow. And that happened not over years or not over months.
See, I have one simple answer to you. I come from an institute called Mahatma Gandhi Institute of Medical Sciences, where the hospital had a general OPD. It was run by family physicians. So every patient had to come there first. So there they are sitting doctors to decide about it. Now regarding the next question, how will I decide I should go Ayurveda or any other medicine? See, it is your decision. Nobody should decide for you. You want to take, a lot of people think, no, this medicine does suit me, I prefer medicine which is safer to me. You're deciding. I tell you about myself. When I did my MBBS and MD pediatrics, I think at the top of the world. Nothing is better than this. So that's how the wisdom increases. As I started increasing, I should tell my friend Ashwini, homeopathy is nothing but a sabudana. Sorry, I just mentioned in front of this one. So, but as I started increasing, I had some time injury. My friend gave me Anika, and there is there's a difference. So that I had a lot of my GI trouble. So instead of taking, and there's good, what is called antibiotics, the good they were taking some kind of what do you call that? Probiotics. So I said, why not have an Ayurveda, so which gives a better probiotic. I had a gallstone. I was about to meet. I had a recent problem in Ayurveda Charai. A friend of mine connected to my Ayurveda Charai. I was told to meet you also, Dr. Ritu. But in the meantime, I had a problem. I had to undergo the surgery. Then I said, boss, there's this place for everything. So this is the answer to you. You had an answer everything. You have to believe it. Thank you.
We are not talking of, I think we are talking of acute medicine. You see, if the person is suffering with acute illness, he is bound to go to the hospital, right? So we have enough time where a person is having arthritis and he is not getting all right, or for various reasons like psoriasis and things. I mean, there are so many diseases like gastroenterology, person is having IBS or is having diarrhea with constipation, things like that, or sleeplessness. So there is enough time. He has to decide whether it will be required to go to a allopath, to a homeopath, to an Ayurvedic specialist. With an obesity problem, what is the urgency of that? It has to be decided right on telephone or otherwise. So I'm sure, what he's saying is that there is a point of contact which decides and sends a person to a board. Well, this person goes probably to a homeopath. That also offers that person.
Also, we will evolve as the thing starts. We will evolve, see what is the best.
I think we should call a close to the session because it's nearing 2 o'clock maybe. And those of us who are hungry can eat lunch. And the rest of the questions can be taken over lunch. But as Dr. Sethia said, that this is just the beginning. This is just the beginning.
Thank you, ma'am. As we proceed further for the distribution of mementos, I would like to invite Dr. Rajan Gadior to felicitate Dr. Vanita Kapoor. Request Dr. Ashwini Seth sir to felicitate Dr. Atul Prasad sir. I would request Ms. Sujaya Krishnan ma'am to felicitate Dr. Deepak sir. to felicitate Dr. Arvind Kishore sir. I would request Air Commander Yadav sir to felicitate Dr. Ritu Sethi ma'am. Can we have a huge round of applause? I would request Ms. Tanuja Joshi ma'am to felicitate Dr. Chitra Setya ma'am. I would request the esteemed dignitaries and the guests to proceed for lunch. I request Ms. Tanuja Joshi ma'am for the vote of thanks.
I know even the anchor is hungry, so I won't take too long. I just wanted to extend my deepest gratitude to our guest of honor, Dr. Rajesh Mehta, for delivering a keynote address. Your words encourage us to move forward with greater resolve. I'd like to thank all the speakers and the panelists for the guidance that they have given, the deliberations that we've had, from your wisdom and your experience. Your perspectives have illuminated the path towards healthcare, a healthcare model that is not just advanced but also collaborative and compassionate. A question that's very often asked is what inspired us to get into integrative medicine? I think while the COVID phase, when it came, it gave a lot of challenges, but it also gave us a lot of opportunity. And one of the opportunities that I got was to think. And that's when we realized that we need to do something more for our patients beyond what we were doing. So we started with a geriatric clinic, and we also realized that along with allopathy, we needed to give them something more, and that's where we entered into naturopathy. But we also realized that in the years to come, the geriatric population is going to increase, and that future geriatric population is also the current population in their 30s and 40s. So we decided to bring in all the branches together. And as some of the speakers and people have commented, everything is working so far in silos. So we need to bring them all together. A dialogue has to start. And so we needed to put the agenda together. And like I believe that the destiny of the patients, at least I believe, everything that in my life has happened only because of the destiny of the patients, very little because of my own efforts. So we were dreaming, at least I was dreaming, and they say it's good to dream and build castles in the air, but don't forget to put foundations. And we were lucky because the destiny brought me in touch with Sumedha madam, who brings with her a huge amount of health management experience, and to put anything together, you need to have experts who have experience. And one link led to the other, and Dr. Rajan Gallior joined the group, and that's what brought Dr. Ashwini Sethia, and that's what brought all of you here today. And I'm so happy that at least there is a dialogue that has been initiated. I understand that there is a lot to do in terms of setting protocols, in the legal aspects, in designing even simple things like when the patient walks in, how does the patient make a choice, how will this whole thing will be facilitated. But we're very happy that at least this has started. I'd like to just show you a few clips. One is that I think Dr. Sethia mentioned that when you walk into this campus, most of the time I hear people saying it's very calm. So we said, if it is so calm, it's a grace of our gurus. Now how do we leverage on this? how do we make this a healing center? We are surrounded by allopathic hospitals here. So can we be an oasis? And just to give you a little glimpse, I'm going to share a drone shot of our hospital. So this is where we are surrounded, and this is a live visual I'm showing you. We don't have a road, I think, a kilometer around us. And the only thing you hear is the chirping of the birds. And this is what we are going to be now moving towards a building which will be taking care of all the requirements of the integrated. This is how futuristic. We have our architect, Mr. Viren here, who's helping us dream of this building. And hopefully this is how we'll end up having the project look at. Another question people ask, and that is that how will the new project build on the 4 decades of Venu's work? The answer is simple. For 40 years, Venu has stood for quality, accessible and compassionate care. This project is a natural extension of that legacy, one that will help us improve patient outcomes, spark new innovation and get ready for a future of healthcare. By expanding into integrative care and research, we are reaffirming Venu's values. We are taking quality healthcare beyond treatment into wellness and prevention, especially for those who need it the most. Integrative medicine is not about choosing one path over another, but walking together for the patient's well-being. Today marks the beginning of a new journey with gratitude in our hearts and optimism for the future. We look forward to building a healthcare system that unites language, enhances care, and truly serves humanity. Thank you once again for joining us on this important day. We wish you all good health and look forward to continuing this journey together. Thank you.